Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is practice questions. Without the way, let's get started.
A 16-year-old client is prescribed 10 milligrams of paroxetine at bedtime for major depression. The nurse should instruct the client and parents to monitor the client closely for which adverse effect? 1. Headache. 2. Nausea. 3. Fatigue. 4. Agitation. The correct answer is 4. Agitation. Rationale. The nurse closely monitors the client taking paroxetine for the development of agitation, which could lead to a self-deletion attempt. Headache, nausea, and fatigue are transient adverse effects of paroxetine. The nurse is planning care with a Mexican client who is diagnosed with depression. The client believes in mal ojo, the evil eye, and uses treatment by a root healer. The nurse should do which of the following? 1. Avoid talking to the client about the root healer. 2. Explain to the client that Western medicine has a scientific, not mystical, basis. 3. Explain that such beliefs are superstitious and should be forgotten. 4. Involve the root healer in a consultation with the client, primary healthcare provider, and nurse. The correct answer is 4. Involve the root healer in a consultation with the client, primary healthcare provider, and nurse. Rationale. Including the root healer gives credibility and respect to the client's cultural beliefs. Avoiding talking about the healer demonstrates either ignorance or disregard for the client's cultural values. Negative comparison of root healing with Western medicine not only denigrates the client's beliefs, but is likely to alienate and cause the client to end treatment. A client was admitted to the inpatient unit 3 days ago with a flat affect, psychomotor retardation, anorexia, hopelessness, and suicidal ideation. The primary healthcare provider prescribed 75 milligrams of venlafaxine, extended release to be given every morning. The client interacted minimally with the staff and spent most of the day in his room. As the nurse enters the unit at the beginning of the evening shift, the client is smiling and cheerful and appears to be relaxed. What should the nurse interpret as the most likely cause of the client's behavior? 1. The Effexor is helping the client's symptoms of depression significantly. 2. The client's sudden improvement calls for close observation by the staff. 3. The staff can decrease their observation of the client. 4. The client is nearing discharge due to the improvement of his symptoms. The correct answer is 2. The client's sudden improvement calls for close observation by the staff. Rationale. The client's sudden improvement and decrease in anxiety most likely indicate that the client is relieved because he has made the decision to delete himself and may now have the energy to complete the deletion. Symptoms of severe depression do not suddenly abate because most antidepressants work slowly and take 2 to 4 weeks to provide a maximum benefit. The client will improve slowly due to the medication. The sudden improvement in symptoms does not mean the client is nearing discharge, and decreasing observation of the client compromises the client's safety. The primary healthcare provider prescribes fluoxetine orally every morning for a 72-year-old client with depression. Which transient adverse effect of this drug requires immediate action by the nurse? 1. Nausea. 2. Dizziness. 3. Sedation. 4. Dry mouth. The correct answer is 2. Dizziness. Rationale. The presence of dizziness could indicate orthostatic hypotension, which may cause injury to the client from falling. Nausea, sedation, and dry mouth do not require immediate intervention by the nurse. After a period of unsuccessful treatment with amitriptyline, a woman diagnosed with depression is switched to tranylcypromine. Which statement by the client indicates the client understands the side effects of tranylcypromine? 1. I need to increase my intake of sodium. 2. I must refrain from strenuous exercise. 3. I must refrain from eating aged cheese or yeast products. 4. I should decrease my intake of foods containing sugar. The correct answer is 3. I must refrain from eating aged cheese or yeast products. Rationale. Cheese and yeast products contain tyramine, which the client should avoid to prevent a negative interaction with tranylcypromine, a monoamine oxidase inhibitor. Sodium will not interact with tranylcypromine, and neither exercise nor sugar needs to be limited. The client is taking 50 milligrams of lamotrigine daily for bipolar depression. The client shows the nurse a rash on his arm. What should the nurse do? 1. Report the rash to the primary healthcare provider. 2. Explain that the rash is a temporary adverse effect. 3. Give the client an ice pack for his arm. 4. Question the client about recent sun exposure. The correct answer is 1. Report the rash to the primary healthcare provider. Rationale. The nurse should immediately report the rash to the primary healthcare provider because lamotrigine can cause Stevens-Johnson syndrome, a toxic epidermal necrolysis. The rash is not a temporary adverse effect. Giving the client an ice pack and questioning the client about recent sun exposure are irresponsible nursing actions because of the possible seriousness of the rash. A client is receiving paroxetine 20 milligrams every morning. After taking the first 3 doses, the client tells the nurse that the medication upsets the stomach. Which of the following instructions should the nurse give to the client? 1. Take the medication an hour before breakfast. 2. Take the medication with some food. 3. Take the medication at bedtime. 4. Take the medication with 4 ounces of orange juice. The correct answer is 2. Take the medication with some food. Rationale. Nausea and gastrointestinal upset is a common, but usually temporary, side effect of paroxetine. Therefore, the nurse would instruct the client to take the medication with food to minimize nausea and stomach upset. Other more common side effects are dry mouth, constipation, headache, dizziness, sweating, loss of appetite. Taking the medication an hour before breakfast would most likely lead to further gastrointestinal upset. Taking the medication at bedtime is not recommended because paroxetine can cause nervousness and interfere with sleep. Because orange juice is acidic, taking the medication with it, especially on an empty stomach, may lead to nausea or increase the client's gastrointestinal upset. A client is scheduled for the first electroconvulsive therapy treatment in the morning. The client has been unable to sleep, but at 10 p.m. refused to take Restoral, as the nurse suggested. The client is still unable to sleep at 11:15 p.m. In what order should the nurse do the following? 1. Sit quietly with the client. 2. Encourage the use of Restoral. 3. Offer use of MP3 player with relaxing music. 4. Discuss specific concerns. The correct order is 1. Sit quietly with the client. 4. Discuss specific concerns. 3. Offer use of MP3 player with relaxing music. And 2. Encourage the use of Restoral. Rationale. The client is likely anxious about the procedure. The nurse should first spend time with the client and then discuss the client's concerns about the procedure. Next, the nurse could suggest the client listen to relaxing music. The use of the sleeping medication would only be considered as a last resort since it might interfere with the effectiveness of the seizure required for the treatment. The client exhibits a flat affect, psychomotor retardation, and depressed mood. The nurse attempts to engage the client in an interaction, but the client does not respond to the nurse. Which response by the nurse is most appropriate? 1. I'll sit here with you for 15 minutes. 2. I'll come back a little bit later to talk. 3. I'll find someone else for you to talk with. 4. I'll get you something to read. The correct answer is 1. I'll sit here with you for 15 minutes. Rationale. The most appropriate action is for the nurse to remain with the client even if the client does not engage in conversation with the nurse. A client with severe depression may be unable to engage in an interaction with a nurse because the client feels worthless and lacks the necessary energy to do so. However, the nurse's presence conveys acceptance and caring, thus helping to increase the client's self-worth. Telling the client that the nurse will come back later, stating that the nurse will find someone else for the client to talk with, or telling the client that the nurse will get her something to read conveys to the client that she is not important, reinforcing the client's negative view of herself. Additionally, such statements interfere with the client's development of a sense of security and trust in the nurse. The nurse is reviewing the laboratory report with the client's lithium level taken that morning prior to administering the 5 p.m. dose of lithium. The lithium level is 1.8 milliequivalents per liter. The nurse should 1. Administer the 5 p.m. dose of lithium. 2. Hold the 5 p.m. dose of lithium. 3. Give the client 8 ounces of water with the lithium. 4. Give the lithium after the client's supper. The correct answer is 2. Hold the 5 p.m. dose of lithium. Rationale: the nurse should hold the 5 p.m. dose of lithium because a level of 1.8 milliequivalents per liter can cause adverse reactions, including diarrhea, vomiting, drowsiness, muscle weakness, and lack of coordination, which are early signs of lithium toxicity. The nurse should report the lithium level to the primary healthcare provider, including any symptoms of toxicity. Administering the 5 p.m. dose of lithium, giving the client the lithium with 8 ounces of water, or giving it after supper would result in an increase of the lithium level, thus increasing the risk of lithium toxicity. After a few minutes of conversation, a female client who is depressed wearily asks the nurse, "Why pick me to talk to? Go talk to someone else." Which of the following replies by the nurse is best? 1. I'm assigned to care for you today if you'll let me. 2. You have a lot of potential and I'd like to help you. 3. I'll talk to someone else later. 4. I'm interested in you and want to help you. The correct answer is 4. I'm interested in you and want to help you. Rationale: the nurse tells the client that the nurse is interested in her to increase the client's sense of importance, worth, and self-esteem. Also, stating that the nurse wants to help conveys to the client that she is worthwhile and important. Telling the client that the nurse is assigned to care for her is impersonal and implies that the client is being uncooperative. Telling the client that the nurse is there because the client has potential for improvement will not help the client with low self-esteem because most people develop a sense of self-worth through accomplishment. Simply saying that the client has a lot of potential will not convince her that she is worthwhile. Telling the client that the nurse will talk to someone else later is not client-focused and does not address the client's question or concern. The client is receiving 6 milligrams of selegiline transdermal system every 24 hours for major depression. The nurse should judge teaching about selegiline to be effective when the client makes which statement? 1. I need to avoid using the sauna at the gym. 2. I can cut the patch and use a smaller piece. 3. I need to wait until the next day to put on a new patch if it falls off. 4. I might gain at least 10 pounds from the medication. The correct answer is 1. I need to avoid using the sauna at the gym. Rationale: selegiline transdermal system is the first transdermal monoamine oxidase inhibitor. The client needs to avoid exposing the application site to external sources of direct heat, such as saunas, heating lamps, electric blankets, heating pads, heated waterbeds, and prolonged direct sunlight, because heat increases the amount of selegiline that is absorbed, resulting in elevated serum levels of selegiline. Cutting the patch and using a smaller piece will result in a decreased amount of medication absorption, most likely leading to a worsening of the symptoms of depression. The client should apply a new patch as soon as possible if one falls off to ensure an adequate amount of medication absorption. Selegiline is not associated with significant weight gain, although a weight gain of 1 to 2 pounds is possible. A client diagnosed with major depression spends most of the day lying in bed with a sheet pulled over his head. Which of the following approaches by the nurse is most therapeutic? 1. Wait for the client to begin the conversation. 2. Initiate contact with the client frequently. 3. Sit outside the client's room. 4. Question the client until the client responds. The correct answer is 2. Initiate contact with the client frequently. Rationale: the nurse should initiate brief, frequent contacts throughout the day to let the client know that he is important to the nurse. This will positively affect the client's self-esteem. The nurse's action conveys acceptance of the client as a worthwhile person and provides some structure to the seemingly monotonous day. Waiting for the client to begin the conversation with the nurse is not helpful because the depressed client resists interaction and involvement with others. Sitting outside of the client's room is not productive and not necessary in this situation. If the client were actively suicidal, then a one-on-one client-to-staff assignment would be necessary. Questioning the client until he responds would overwhelm him because he could not meet the nurse's expectations to interact. A client has been taking 30 milligrams of duloxetine hydrochloride twice daily for 2 months because of depression and vague aches and pains. While interacting with the nurse, the client discloses a pattern of drinking a six-pack of beer daily for the past 10 years to help with sleep. What should the nurse do first? 1. Refer the client to the dual diagnosis program at the clinic. 2. Share the information at the next interdisciplinary treatment conference. 3. Report the client's beer consumption to the primary healthcare provider. 4. Teach the client relaxation exercises to perform before bedtime. The correct answer is 3. Report the client's beer consumption to the primary healthcare provider. Rationale. The nurse should report the client's beer consumption to the primary healthcare provider. Duloxetine should not be administered to a client with renal or hepatic insufficiency because the medication can elevate liver enzymes and, together with substantial alcohol use, can cause liver injury. Referring the client to the dual diagnosis program, sharing information at the next interdisciplinary treatment conference, and teaching the client relaxation exercises are helpful interventions for the nurse to implement. However, reporting the findings to the primary healthcare provider is most important. A nurse is conducting a psychoeducational group for family members of clients hospitalized with depression. Which family member's statement indicates a need for additional teaching? 1. My husband will slowly feel better as his medicine takes effect over the next 2 to 4 weeks. 2. My wife will need to take her antidepressant medicine and go to group to stay well. 3. My son will only need to attend outpatient appointments when he starts to feel depressed again. 4. My mother might need help with grocery shopping, cooking, and cleaning for a while. The correct answer is 3. My son will only need to attend outpatient appointments when he starts to feel depressed again. Rationale. Additional teaching is needed for the family member who states her son will only need to attend outpatient appointments when he starts to feel depressed again. Compliance with medication and outpatient follow-up are key in preventing relapse and rehospitalization. The statements expressing expectations of feeling better as medication takes effect, needing medicine and group therapy to stay well, and needing help with grocery shopping, cooking, and cleaning for a while indicate the family's understanding of depression, medication, and follow-up care. A nurse manager is informed that a large number of clients will be admitted in response to a terrorist attack. Which type of leadership style is appropriate to use in this situation? 1. Collaborative. 2. Authoritarian. 3. Laissez-faire. 4. Democratic. The correct answer is 2. Authoritarian. Rationale. The authoritarian leadership style is the appropriate style to use in a crisis when urgent decisions are necessary. In a crisis, one person must assume the responsibility for decisions. Autocratic leaders give orders and directions and make decisions for the group. Collaborative is not a classic leadership style. Collaborative refers to the democratic leadership style. Democratic leaders encourage discussion and decision-making within the group, which requires collaboration, coordination, and communication among group members. The laissez-faire leadership style is not the appropriate style to use in a crisis when urgent decisions are necessary. Laissez-faire leaders are non-directive and permissive, which allows for self-regulation, creativity, and autonomy but limits fast-acting efficiency. The democratic leadership style is not the appropriate style to use in a crisis when urgent decisions are necessary. Democratic leaders encourage discussion and decision-making within the group, which takes time. A nurse manager considers that there are the rights of delegation, which is a right of delegation in addition to right task, right person, right communication, and right time. 1. Place. 2. Route. 3. Feedback. 4. Supervision. The correct answer is for supervision. Rationale. The one who delegates a task is responsible for ensuring that the task is performed safely and according to standards of practice. The right place is not one of the rights of delegation. The right route refers to the rights of medication administration, not the rights of delegation. Feedback is part of communication, which is one of the rights of delegation already cited in the stem of the question. Which is the most important reason why a nursing assistant must fully understand how to implement a delegated procedure? 1. Be capable of completing the procedure safely. 2. Be proficient enough to perform the procedure quickly. 3. Have the knowledge to explain the procedure to a client. 4. Have the correct information when teaching the procedure to another nursing assistant. The correct answer is 1. Be capable of completing the procedure safely. Rationale: safety of the client is the priority. The nursing assistant must perform only the skills that are within the legal role of the nursing assistant and perform correctly on a return demonstration. Nurse aides are trained and supervised by the nurse, not other nurse aides. The nursing team consists of a nurse in charge, a licensed nurse, and a nursing assistant. Which task should be delegated to a licensed nurse rather than the nursing assistant? Select all that apply. 1. Obtaining routine vital signs. 2. Providing discharge teaching. 3. Ambulating a stable client in the hall. 4. Transporting a client to another location for an X-ray examination. The correct answer is 2. Providing discharge teaching. Rationale: discharge teaching requires the knowledge and judgment of a licensed nurse. It requires synthesizing and summarizing information, as well as coordinating a variety of community healthcare services to meet client needs. Taking routine vital signs is not complex, has little potential for harm, requires only simple problem-solving skills, involve a simple level of interaction with the client, and is within the scope of practice of a nursing assistant. Taking vital signs requires the more advanced competencies of a licensed nurse when previous vital signs have been outside the expected range, the client is unstable, or the client is transferred from one service/unit to another. Ambulating a stable client in the hall is within the scope of practice of a nursing assistant and does not require the educational skill of a nurse. Transporting a client is not a complex task. It requires simple problem-solving skills and involves a predictable outcome and a simple level of interaction with the client. It does not require the more advanced competencies of a nurse. Which should the manager do first to overcome resistance to change? 1. Ensure that the plan change is within the current beliefs and values of the group. 2. Provide incentives to encourage commitment of participants to the change. 3. Implement change by employing small steps rather than large steps. 4. Use influence power to ensure that goals of change are met. The correct answer is 1. Ensure that the plan change is within the current beliefs and values of the group. Rationale: change that is consistent with current values and beliefs is easier to implement than change that is inconsistent with current values and beliefs. Values and beliefs are difficult to change. Option 2 is not the priority intervention. Although incentives might motivate some individuals, they do not motivate all because some people have an internal rather than an external locus of control. In option 3, although small steps are more effective than large steps because they are easier to achieve and once achieved are motivating, this approach is not the first thing the nurse should do to overcome resistance to change. In option 4, although one person sharing explanations with another is helpful when trying to change behavior, it is not the most effective type of power to use when trying to affect change. A nursing team leader delegates a wound irrigation to a licensed practical nurse. It has been a long time since the LPN performed this procedure. Which should the nursing team leader do to ensure client safety? 1. Verbally describe how to perform the procedure to the LPN. 2. Have the LPN demonstrate how to perform the procedure. 3. Assign another LPN to assist with the procedure. 4. Delegate the procedure to another LPN. The correct answer is 2. Have the LPN demonstrate how to perform the procedure. Rationale: demonstration is the safest way to assess whether a person has the knowledge and skill to perform a procedure safely. A superior delegating care is responsible for ensuring that the person implementing the care is legally qualified and competent. Providing just a verbal description is unsafe. This does not ensure that cognitive information can be converted to a psychomotor skill. A peer should not be held responsible for the care assigned to another team member. The nurse who delegates a procedure to a subordinate is directly responsible for ensuring that the care is safely delivered to clients. Option 4 does not address the original licensed practical nurses, need to know how to perform the procedure safely. This procedure is within the legal scope of practice of a licensed practical nurse. A nurse and a nursing assistant are working together on a surgical unit. Which activity should the nurse assign to the nursing assistant? Select all that apply. 1. Taking vital signs of clients who are stable. 2. Delivering meal trays to clients who are in isolation. 3. Explaining to a client how to use an incentive spirometer. 4. Changing the linens on beds that are occupied by clients who are on bed rest. 5. Emptying a urine collection bag that is attached to continuous bladder irrigation. The correct answers are 1. Taking vital signs of clients who are stable. 2. Delivering meal trays to clients who are in isolation. 4. Changing the linens on beds that are occupied by clients who are on bed rest. And 5. Emptying a urine collection bag that is attached to continuous bladder irrigation. Rationale. Taking vital signs of clients who are stable is within the scope of practice of a nursing assistant. Determining the significance of the results of routine vital signs requires the expertise of a nurse. Delivering meal trays to clients who are in isolation is within the scope of practice of a nursing assistant. Nursing assistants are taught how to use personal protective equipment. Changing the linens on beds that are occupied by clients who are on bed rest is within the scope of practice of a nursing assistant. The activity is simple and repetitive. Emptying and recording the volume of output collected from a urine collection bag is within the legal role of a nursing assistant. The nurse will then calculate the volume of urine by deducting the volume of irrigating solution instilled from the total output. Calculating the actual urine output is an assessment that requires the skill of a nurse. Client teaching is within the legal scope of a nurse, not a nursing assistant. Teaching requires a complex level of interaction with the client, problem solving, and innovation in the form of an individually designed teaching plan of care that addresses the specific learning needs of the client. In addition, the outcome is unpredictable and it has the potential to cause harm if the skill is taught incorrectly. Several nurses complain to the nurse manager that one of the nursing assistants constantly takes extensive lunch breaks. Which should the nurse manager do? 1. Convene a group meeting of all the nursing assistants to review their responsibilities related to time management. 2. Talk with the nursing assistant to explore the reasons for the behavior and review expectations. 3. Arrange a meeting with the nurses so that they can confront the nursing assistant as a group. 4. Document the nursing assistant's behavior and place it in the aides personnel file. The correct answer is 2. Talk with the nursing assistant to explore the reasons for the behavior and review expectations. Rationale. Recognition of a problem is the first step in the problem-solving process. Once the unacceptable behavior is identified and acknowledged, then the reasons for the problem can be explored, solutions suggested, and expectations reinforced. In option 1, it is the nursing assistant who is late and takes extensive lunch breaks who needs to review the responsibilities related to time, not the nursing assistants who follow the rules. It is not the responsibility of others to confront the employee who is late for work and takes extensive lunch breaks. The employee reports to the nurse manager, who is superior in the chain of command of the organization. The nurse manager should meet with the employee. In addition, counseling sessions with employees should be confidential and conducted in private. Option 4 is premature. The nurse manager first should implement an action identified in another option. Place the following steps of the decision-making process in the order in which they should be implemented by a nurse. 1. Identify possible solutions to the problem. 2. Gather relevant information. 3. Identify the problem. 4. Evaluate the result. 5. Test the solution. The correct order is 3. Identify the problem. 2. Gather relevant information. 1. Identify possible solutions to the problem. 5. Test the solution. And 4. Evaluate the result. Rationale. The first step in the decision-making process is defining and describing the problem. The second step in the decision-making process is gathering significant information associated with the problem. The third step of the decision-making process is identifying promising strategies to resolve the problem. The fourth step of the decision-making process is implementing an action to address the problem. The fifth step of the decision-making process is evaluating the results by comparing the actual outcomes to the expected outcomes of the employed solution to the problems. Which should the nurse do to ensure efficiency when managing a daily assignment? 1. Give care to a client in isolation first. 2. Plan activities to promote nursing convenience. 3. Organize care around legally required activities. 4. Perform routine bed baths between breakfast and lunch. The correct answer is 3. Organize care around legally required activities. Rationale. Legally required activities must be accomplished because they are dependent functions that support the medical regimen of care. Although legally required activities should be accomplished first, many independent actions by the nurse also must be implemented to maintain a basic standard of care and client safety. Some nursing interventions, which are not essential, can be implemented after the required activities. Client needs are the priority, not the convenience of the nurse. Options 1 and 4 may not be possible, depending on the needs of clients. A client is to be discharged from the hospital. Which discharge task can be delegated to a nursing assistant? Select all that apply. 1. Teaching the client how to measure weight using a standing scale. 2. Obtaining the client's temperature, pulse, and respiratory rate. 3. Determining if the client knows how to measure fluid intake. 4. Demonstrating to the client how to safely use a walker. 5. Reviewing foods that are high in vitamin C. The correct answer is 2. Obtaining the client's temperature, pulse, and respiratory rate. Rationale. Teaching a client how to obtain a body weight requires the knowledge and judgment of a nurse. Teaching requires a complex level of interaction with the client, problem solving, and innovation in the form of an individually designed teaching plan of care that addresses the specific learning needs of the client. In addition, the outcome is unpredictable, and it has the potential to cause harm if the skill is taught incorrectly. Obtaining vital signs can be delegated to a nursing assistant because it is not a complex task. It requires simple problem-solving skills and a simple level of interaction with the client. Although this task has the potential to cause harm if the critical elements of the skill are not implemented appropriately, it is within the scope of practice of a nursing assistant. It does not require the more advanced competencies of a nurse. Assessing a client's level of understanding is a complex task that requires knowledge and judgment and is within the scope of practice of a nurse. This task requires a complex level of interaction with the client, problem solving, and innovation in the form of an individually designed teaching plan of care that addresses the specific learning needs of the client. Teaching a client how to use a walker requires the knowledge and judgment of a nurse. Reviewing foods that are high in vitamin C requires the knowledge and judgment of a nurse. A first-year nursing student in the clinical area is given an appropriate client assignment by the instructor. Which should the student nurse do? 1. Complete the care indicated on the client's plan of care. 2. Accept the role of leader of the client's healthcare team. 3. Assume accountability for the tasks that are assigned by the instructor. 4. Help other students to complete their assigned tasks whenever necessary. The correct answer is 3. Assume accountability for the tasks that are assigned by the instructor. Rationale. Students are accountable for the tasks assigned by the instructor or preceptor. As part of accountability, students are obligated to keep the instructor or preceptor informed about the status of the client, how the assignment is progressing, and whether all interventions are implemented as planned. Although students are expected to complete all planned care, the client's condition can change or some unforeseen event may interfere with the plan. The student must keep the instructor or preceptor informed about the client's condition and use the instructor or preceptor as a resource person when the unexpected occurs or guidance is needed. Students are assigned to care for clients for a specific time period and generally are included as members, not leaders of the nursing team, particularly beginning nursing students. Students should not help other students unless specifically assigned to do so by the instructor or preceptor. An exception occurs when assistance is needed to ensure client safety in an emergency. A nurse manager plans to provide feedback to a subordinate who needs a change in behavior. Which is the first intervention by the nurse manager? 1. Be assertive. 2. Explore alternatives. 3. Identify the unacceptable behavior. 4. Document the content of the counseling session. The correct answer is 3. Identify the unacceptable behavior. Rationale. Problem recognition is the first step in the problem-solving process. Once the unacceptable behavior is identified and acknowledged, then the reasons for the problem can be explored, solutions suggested, and expectations reinforced. The nurse manager can provide negative feedback that is firm without being assertive. Not yielding under pressure is less confrontational than being confident in a persistent way. When providing negative feedback, the exploration of alternative solutions is performed later in the counseling session. Although documenting the content of the counseling session should be done, it is not feedback. Feedback is necessary for the subordinate to recognize one's offending behavior. In addition, documentation is the last, not the first, step in the counseling process. When delegating a specific procedure to a client care aide, the aide refuses to perform the procedure. Which should the nurse do first? 1. Assign the procedure to another client care aide. 2. Explain that it is part of the client care aide's job description. 3. Explore why the client care aide refused to perform the procedure. 4. Send the client care aide to the procedure manual to review the procedure. The correct answer is 3. Explore why the client care aide refused to perform the procedure. Rationale. The nurse must first explore the reason for the nurse aide's refusal to perform the procedure. The employee may have an acceptable reason for refusing to comply. When the reason is identified, then the nurse manager can take an informed action. Assigning the procedure to another staff member is premature. Another option has priority. The employee may be fully aware of the requirements of the job description and not need to have them described. Even though a task is within one's job description, a person can refuse to perform a procedure because of a reason that is considered acceptable. A nurse manager is experiencing staff resistance when implementing change. Which is the most important action by the nurse manager to overcome resistance to change? 1. Identify the reason for the resistance. 2. Restate the purpose of the change concisely. 3. Modify the goals to appeal to more key people. 4. Emphasize the positive consequences of the planned change. The correct answer is 1. Identify the reason for the resistance. Rationale. Option 1 is essential to overcome resistance to change. There are many different reasons people resist change. Each person will respond to different strategies. There are 4 different types of interventions to overcome resistance: providing information, disproving currently held beliefs, maintaining psychological safety, and administrating an order or command. Although it is important to state the purpose of the change clearly and concisely, another option is a more important action that can be implemented by the nurse manager to overcome resistance to change. Modifying a goal compromises the integrity of the planned change. All ramifications associated with the change should be explored before beginning, and all contingencies planned for, so that modifying a goal will be unnecessary. Although emphasizing the positive consequences of the planned change might be done, another option is a more important action that can be implemented by the nurse manager to overcome resistance to change. Which of the following outcomes should the nurse include in the initial plan of care for a client who is exhibiting psychomotor retardation, withdrawal, minimal eye contact, and unresponsiveness to the nurse's questions? 1. The client will initiate interactions with peers. 2. The client will participate in milieu activities. 3. The client will discuss adaptive coping techniques. 4. The client will interact with the nurse. The correct answer is 4. The client will interact with the nurse. Rationale. In the initial plan of care, the most appropriate outcome would be that the client will interact with the nurse. First, the client would begin interacting with one individual, the nurse. The nurse would gradually assist the client to engage in interactions with other clients in one-on-one contacts, progressing toward informal group gatherings, and eventually taking part in structured group activities. The client needs to experience success according to the client's level of tolerance. Initiating interactions with peers occurs when the client can gain a measure of confidence and self-esteem instead of feeling intimidated or unduly anxious. Discussing adaptive coping techniques is an outcome the client may be able to reach when symptoms are not as severe and the client can concentrate on improving coping skills. Which of the following statements by a client taking trazodone deserel as prescribed by the primary healthcare provider indicates to the nurse that further teaching about the medication is needed? 1. I will continue to take my medication after a light snack. 2. Taking deserel at night will help me to sleep. 3. My depression will be gone in about 5 to 7 days. 4. I won't drink alcohol while taking deserel. The correct answer is 3. My depression will be gone in about 5 to 7 days. Rationale. Symptom relief can occur during the first week of therapy, with optimal effects possible within 2 weeks. For some clients, 2 to 4 weeks is needed for optimal effects. The client statement that the depression will be gone in 5 to 7 days indicates to the nurse that clarification and further teaching is needed. Trazodone should be taken after a meal or light snack to enhance its absorption. Trazodone can cause drowsiness, and therefore the major portion of the drug should be taken at bedtime. The depressant effects of central nervous system depressants and alcohol may be potentiated by this drug. When preparing a teaching plan for a client about imipramine, tofranil, which of the following substances should the nurse tell the client to avoid while taking the medication? 1. Caffeinated coffee. 2. Sunscreen. 3. Alcohol. 4. Artificial tears. The correct answer is 3. Alcohol. Rationale. Imipramine, a tricyclic antidepressant in combination with alcohol, will produce additive central nervous system depression. Although caffeinated coffee is safe to use when the client is taking imipramine, it is not recommended for a client with depression who may be experiencing sleep disturbances. Imipramine may cause photosensitivity, so the client would be instructed to use sunscreen and protective clothing when exposed to the sun. Reduced lacrimation may occur as a side effect of imipramine. Therefore, the use of artificial tears may be recommended. Which of the following statements made by an adolescent who has just begun taking an antidepressant would indicate the need for further teaching about the action of antidepressants in treating depression? 1. Now that I've been taking my antidepressant for a week, I'm going to feel better about myself. 2. A week ago when I started my antidepressant, I didn't care about eating, but now I want to eat a bit more. 3. After a week of taking my antidepressant, I can sleep a little better, 6 hours or so each night. 4. Now that I've had a week of my antidepressant, it is a little easier to get up in the morning. The correct answer is 1. Now that I have been taking my antidepressant for a week, I'm going to feel better about myself. Rationale. In the first week or so of taking an antidepressant, the vegetative symptoms of depression such as poor sleep, appetite, and energy level improve. However, it takes 3 to 4 weeks for improvement in self-concept/self-esteem to take place. A 62-year-old female client with severe depression and psychotic symptoms is scheduled for electroconvulsive therapy tomorrow morning. The client's daughter asks the nurse, "How painful will the treatment be for mom?" The nurse should respond by saying which of the following? 1. Your mother will be given something for pain before the treatment. 2. The primary healthcare provider will make sure your mother doesn't suffer needlessly. 3. Your mother will be asleep during the treatment and will not be in pain. 4. Your mother will be able to talk to us and tell us if she's in pain. The correct answer is 3. Your mother will be asleep during the treatment and will not be in pain. Rationale. The nurse should explain that ECT is a safe treatment and that the client is given an ultra-short-acting anesthetic to induce sleep before ECT and a muscle relaxant to prevent musculoskeletal complications during the convulsion, which typically lasts 30 to 60 seconds to be therapeutic. Atropine is given before ECT to inhibit salivation and respiratory tract secretions and thereby minimize the risk of aspiration. Medication for pain is not necessary and is not given before or during the treatment. Some clients experience a headache after the treatment and may request and be given an analgesic such as acetaminophen. Telling the daughter that the primary healthcare provider will ensure that the client does not suffer needlessly would not provide accurate information about ECT. This statement also implies that the client will have pain during the treatment, which is untrue. The intake nurse is making an assessment of a client who has just arrived at the emergency department. Which of the following comments from this client who is taking phenelzine? a monoamine oxidase inhibitor for treatment-resistant depression should be given top priority. 1. My bowels haven't moved in the last 2 days. 2. What was my temperature? I'm feeling warm. 3. My legs feel stiff after I sit in the chair for a while. 4. I have a throbbing headache. The correct answer is 4. I have a throbbing headache. Rationale. A serious, life-threatening reaction to MAO inhibitors is hypertensive crisis. Although this medication is inclined to reduce blood pressure, in combination with too much tyramine, blood pressure can rise to a dangerous level. A throbbing headache could be a significant indicator of an impending crisis. During a group session, a client who is depressed tells the group that he lost his job. Which of the following responses by the nurse is best? 1. It must have been very upsetting for you. 2. Would you tell us about your job? 3. You'll find another job when you're better. 4. You were probably too depressed to work. The correct answer is 1. It must have been very upsetting for you. Rationale. By stating, it must have been very upsetting for you, the nurse conveys empathy to the client by recognizing the underlying meaning of a painful occurrence. The nurse's statement invites the client to verbalize feelings and thoughts and lets the client know that the nurse is listening to and respects the client. Telling the client to talk about the job disregards the client's feelings and is non-therapeutic for the depressed client because of underlying feelings of worthlessness and guilt that are commonly present. Telling the client that he will find another job when he is better or that he was probably too depressed to work is inappropriate because it disregards the client's feelings and may promote additional feelings of failure and inadequacy in the client. A client comes to the mental health clinic for a follow-up visit for a diagnosis of major depressive disorder. He says that he has been taking his escitalopram oxalate as prescribed since his second hospitalization 3 months ago. He tells the nurse that he is feeling like my old self again. Now he wants to stop taking medication. I don't want to be dependent on meds like my father. What is the nurse's best initial response to him? 1. After another 3 months of stability, it might be safe for you to go off the escitalopram. 2. After 2 significant episodes, you will need to take an antidepressant indefinitely. 3. Research indicates that individuals who have had 2 major depressive episodes have a 70% chance of having a third episode. 4. It is likely that you can learn to manage your depression with a regular exercise regime and a healthy diet. The correct answer is 3. Research indicates that individuals who have had 2 major depressive episodes have a 70% chance of having a third episode. Rationale. After 2 episodes of a major depressive disorder, the likelihood of a third episode increases to 70%. This information would be useful to convey prior to discussing the importance of continuing his medication. This client also has a family history of depression. A healthy diet and exercise are very significant adjuncts to the therapeutic plan, but may not be sufficient as standalone therapy. A male client who is very depressed exhibits psychomotor retardation, a flat affect, and apathy. The nurse observes the client to be in need of grooming and hygiene. Which of the following nursing actions is most appropriate? 1. Explaining the importance of hygiene to the client. 2. Asking the client if he is ready to shower. 3. Waiting until the client's family can participate in the client's care. 4. Stating to the client that it's time for him to take a shower. The correct answer is 4. Stating to the client that it's time for him to take a shower. Rationale. The client with depression is preoccupied, has decreased energy, and cannot make decisions, even simple ones. Therefore, the nurse presents the situation, it's time for a shower, and assists the client with personal hygiene to preserve his dignity and self-esteem. Explaining the importance of good hygiene to the client is inappropriate because the client may know the benefits of hygiene, but is too fatigued and preoccupied to pay attention to self-care. Asking the client if he is ready for a shower is not helpful because the client with depression commonly cannot make even simple decisions. This action also reinforces the client's feeling about not caring about showering. Waiting for the family to visit to help with the client's hygiene is inappropriate and irresponsible on the part of the nurse. The nurse is responsible for making basic decisions for the client until the client can make decisions for himself. A nurse is educating a client who has been diagnosed with dysphonia about possible treatment for the disorder. Which response by the nurse is most appropriate? 1. Antidepressants, particularly the selective serotonin reuptake inhibitor, SSRI, group, offer you the best treatment for your dysphonia. 2. Doctors recommend that clients experiencing dysphonia receive electroconvulsive therapy, ECT, to treat their disorder. 3. Because you have a mild, though long-lasting dysthymic mood, psychotherapy can usually bring improvement with less likelihood of the need for medication. 4. Since your dysphonia indicates a long-lasting mild depression, long-term psychoanalysis would be the best treatment for you. The correct answer is 3. Because you have a mild, though long-lasting dysthymic mood, psychotherapy can usually bring improvement with less likelihood of the need for medication. Rationale. Dysthymia is a milder, persistent type of depression in which sufferers are able to minimally carry on their work. Antidepressant and ECT are treatments used for occurrences of major depression, with ECT being used as a last resort when several medications fail. Psychoanalysis is a very involved, long-term treatment rarely used now due to its cost and the long period of treatment required for results. When developing the teaching plan for the family of a client with severe depression who is to receive electroconvulsive therapy, ECT, which of the following information should the nurse include? 1. Some temporary confusion and disorientation immediately after treatment is common. 2. During an ECT treatment session, the client is at risk for aspiration. 3. Clients with severe depression usually do not respond to ECT. 4. The client will not be able to breathe independently during a treatment. The correct answer is 1. Some temporary confusion and disorientation immediately after a treatment is common. Rationale. The family needs to be informed that some confusion and disorientation will occur as the client emerges from anesthesia immediately after ECT to lessen their fear and anxiety about the procedure. The nurse will assist the client with reorientation and will give clear, simple instructions. The client may need to lie down after ECT because of the effects of the anesthesia. Informing the family that there is a danger of aspiration during ECT is inappropriate and unnecessary. The risk of aspiration occurring during ECT is minimal because food and fluids are withheld for 6 to 8 hours before the treatment. In addition, the client receives atropine to inhibit salivation and respiratory tract secretions. Telling the family that the client will not be able to breathe independently during ECT may frighten them unnecessarily. If asked, the nurse should inform the family that the anesthesiologist mechanically ventilates the client with 100% oxygen immediately before the treatment. The client with severe depression responds to ECT. Usually, ECT is used for those who are severely depressed and not responding to pharmacotherapy. A client with major depressive disorder has independently showered, dressed, and washed her hair for the first time since her admission to the inpatient unit 4 days ago. In an interaction with the nurse, she still stresses her faults. She states, "I'm just no good. I can't do anything right." The nurse's best response would be 1. You look very nice today. 2. You were able to shower, wash your hair, and dress today. 3. I'll get out the craft project that you wanted to complete. 4. What is your goal for today? The correct answer is 2. You were able to shower, wash your hair, and dress today. Rationale. An objective reflection by the nurse based on actual behavior is the best affirmation for the client to help boost self-esteem. Depressed persons tend to reject positive opinions from others. Picking a project for such a client is also likely to bring a negative response and/or foster dependence. Antipsychotics are sometimes prescribed for clients with bipolar disorder and would not pose a special concern. The client with recurring depression will be discharged from the psychiatric unit. Which suggestion to the family is best to help them prepare for the client's return home? 1. Discourage visitors while the client is at home. 2. Provide for a schedule of activities outside the home. 3. Involve the client in usual at-home activities. 4. Encourage the client to sleep as much as possible. The correct answer is 3. Involve the client in usual at-home activities. Rationale. It is best to involve the client in usual at-home activities as much as the client can tolerate them. Discouraging visitors may not be in the client's best interest because visits with supportive significant others will help reinforce supportive relationships, which are important to the client's self-worth and self-esteem. Providing for a schedule of activities outside the home may be overwhelming for the client initially. Involving the client in planning for outside activities would be appropriate. Encouraging the client to sleep as much as possible is non-therapeutic and promotes withdrawal from others. A client diagnosed with major depression has sleep and appetite disturbances and a flat affect and is withdrawn. The client has been taking fluvoxamine Luvox, 50 milligrams twice daily for 5 days. Which client behavior is most important to report to the next shift? 1. Client's flat affect. 2. Clients interacting with a visitor. 3. Clients sleeping from 11 p.m. to 6 a.m. 4. Client spending the entire evening in her room. The correct answer is 3. Client sleeping from 11 p.m. to 6 a.m. Rationale. The most important behavior to report to the next shift is that the client was able to sleep from 11 p.m. to 6 a.m. This indicates that improvement in the symptoms of depression is occurring as a result of pharmacologic therapy. The nurse would expect to observe improvement in sleep, appetite, and psychomotor behavior first before improvement in cognitive symptoms. The client's flat affect is still a symptom of depression. The fact that the client had a visitor is not as important as changes in the client's behavior. Spending the evening in her room is a continuation of the client's withdrawn behavior and is important to report, but not as important as the improvement in sleep. A client with major depression is to be discharged home tomorrow. When preparing the client's discharge plan, which of the following areas is most important for the nurse to review with the client? 1. Future plans for going back to work. 2. A conflict encountered with another client. 3. Results of psychological testing. 4. Medication management with outpatient follow-up. The correct answer is 4. Medication management with outpatient follow-up. Rationale. Medication management with outpatient follow-up is of vital importance to discuss with the client before discharge. The nurse teaches and clarifies any questions related to medication and outpatient treatment. The client also has the opportunity to voice feelings related to medication and treatment. The goal is to assist the client in making a successful transition from hospital to home with optimal functioning outside the hospital for as long as possible. The nurse may also need to assist with decreasing any anxiety the client may have related to discharge. Discussing future plans for returning to work or employment is not as immediate a concern as assisting with medication and treatment compliance. Noncompliance with medication is a primary cause of relapse in a client with a psychiatric disorder. Reviewing a conflict the client had encountered with another client is not appropriate or therapeutic at this time unless the client brings it to the nurse's attention. The conflict should have been dealt with and resolved when it occurred. Reviewing the results of psychological testing is the responsibility of the primary healthcare provider if he chooses. The client with depression has been consistent with taking 12.5 milligrams of paroxetine, Paxil, extended release daily. The nurse judges the client to be benefiting from this drug therapy when the client demonstrates which of the following behaviors? Select all that apply. 1. Takes 2-hour evening naps daily. 2. Completes homework assignments. 3. Decreases pacing. 4. Increases somatization. 5. Verbalizes feelings. The correct answers are 2. Completes homework assignments. 3. Decreases pacing. And 5. Verbalizes feelings. Rationale. Symptoms of depression include depressed mood, appetite disturbance, sleep disturbance, psychomotor disturbance, fatigue, feelings of worthlessness, excessive or inappropriate guilt, and decreased concentration. Paroxetine is a selective serotonin reuptake inhibitor antidepressant that also can be used to treat anxiety. Improved concentration, verbalization of feelings, and decreased agitation or pacing are signs of improvement. Taking 2-hour evening naps daily is still a sign of fatigue or lack of energy, and the increased use of somatization could be signs of continued symptoms of depression. The client who has been taking venlafaxine Effexor 25 milligrams PO 3 times a day for the past 2 days states, "This medicine isn't doing me any good. I'm still so depressed." Which of the following responses by the nurse is most appropriate? 1. Perhaps we'll need to increase your dose. 2. Let's wait a few days and see how you feel. 3. It takes about 2 to 4 weeks to receive the full effects. 4. It's too soon to tell if your medication will help you. The correct answer is 3. It takes about 2 to 4 weeks to receive the full effects. Rationale: the client needs to be informed of the time lag involved with antidepressant therapy. Although improvement in the client's symptoms will occur gradually over the course of 1 to 2 weeks, typically it takes 2 to 4 weeks to get the full effects of the medication. This information will help the client be compliant with medication and will also help in decreasing any anxiety the client has about not feeling better. The client's dose may not need to be increased. It is too early to determine the full effectiveness of the drug. Additionally, such a statement may increase the client's anxiety and diminish self-worth. Telling the client to wait a few days discounts the client's feelings and is inappropriate. Although it is too soon to tell whether the medication will be effective, telling this to the client may cause the client undue distress. This statement is somewhat negative because it is possible that the medication will not be effective, possibly further compounding the client's anxiety about not feeling better. A client taking paroxetine, Paxil, 40 milligrams PO every morning tells the nurse that her mouth feels like cotton. Which of the following statements by the client necessitates further assessment by the nurse? 1. I'm sucking on ice chips. 2. I'm using sugarless gum. 3. I'm sucking on sugarless candy. 4. I'm drinking 12 glasses of water every day. The correct answer is 4. I'm drinking 12 glasses of water every day. Rationale: dry mouth is a common, temporary side effect of paroxetine. The nurse needs to further assess the client's water intake when the client states she is drinking lots of water. Excessive intake of water could be harmful to the client and could lead to electrolyte imbalance. Dry mouth is caused by the medication, and drinking a lot of water will not eliminate it. Sucking on ice chips or using sugarless gum or candy is appropriate to ease the discomfort of dry mouth associated with paroxetine. The client states to the nurse, "I take citalopram, Celexa, 40 milligrams every day as my primary healthcare provider prescribed. I have also been taking St. John's wort 750 milligrams daily for the past 2 weeks." Which of the following indicate that the client is developing serotonin syndrome? Select all that apply. 1. Confusion. 2. Restlessness. 3. Constipation. 4. Diaphoresis. 5. Ataxia. The correct answers are 1. Confusion, 2. Restlessness, 4. Diaphoresis, and 5. Ataxia. Rationale: serotonin syndrome can occur if a selective serotonin reuptake inhibitor is combined with a monoamine oxidase inhibitor, a tryptophan serotonin precursor, or St. John's wort. Signs and symptoms of serotonin syndrome include mental status changes, such as confusion, restlessness or agitation, headache, diaphoresis, ataxia, myoclonus, shivering, tremor, diarrhea, nausea, abdominal cramps, and hyperreflexia. Constipation is not associated with serotonin syndrome. When developing a teaching plan for a client about the medications prescribed for depression, which of the following components is most important for the nurse to include? 1. Pharmacokinetics of the medication. 2. Current research related to the medication. 3. Management of common adverse effects. 4. Dosage regulation and adjustment. The correct answer is 3. Management of common adverse effects. Rationale: compliance with medication therapy is crucial for the client with depression. Medication noncompliance is the primary cause of relapse among psychiatric clients. Therefore, the nurse needs to teach the client about managing common adverse effects to promote compliance with medication. Teaching the client about the medication's pharmacokinetics may help the client to understand the reason for the drug. However, teaching about how to manage common adverse effects to promote compliance is crucial. Current research about the medication is more important to the nurse than to the client. Teaching about dosage regulation and adjustment of medication may be helpful, but typically the primary healthcare provider, not the client, is the person in charge of this aspect. When teaching the client with atypical depression about foods to avoid while taking phenelzine, which of the following should the nurse include? 1. Roasted chicken. 2. Salami. 3. Fresh fish. 4. Hamburger. The correct answer is 2. Salami. Rationale. Phenelzine is a monoamine oxidase inhibitor. MAOIs block the enzyme monoamine oxidase, which is involved in the decomposition and inactivation of norepinephrine, serotonin, dopamine, and tyramine. Foods high in tyramine. Those that are fermented, pickled, aged, or smoked must be avoided because when they are ingested in combination with MAOIs, a hypertensive crisis occurs. Some examples include salami, bologna, dried fish, sour cream, yogurt, aged cheese, bananas, pickled herring, caffeinated beverages, chocolate, licorice, beer, red wine, and alcohol-free beer. A client taking mirtazapine is disheartened about a 20 pounds, 9 kilograms, weight gain over the past 3 months. The client tells the nurse, "I stopped taking my mirtazapine 15 days ago. I don't want to get depressed again, but I feel awful about my weight." Which response by the nurse is most appropriate? 1. Focusing on diet and exercise alone should control your weight. 2. Your depression is much better now, so your medication is helping you. 3. Look at all the positive things that have happened to you since you started mirtazapine. 4. I hear how difficult this is for you and will help you approach the doctor about it. The correct answer is 4. I hear how difficult this is for you and will help you approach the doctor about it. Rationale. The nurse should express concern for the client and offer to help the client speak with the primary healthcare provider, which will lend support to the client's concerns. The client who has stopped the medication must be taken seriously because medication noncompliance could result in a recurrence of symptoms of depression. Telling the client to focus on diet and exercise ignores the client's feelings and subtly implies the weight gain is the client's fault. Pointing out that the medication has helped and that positive things have happened since the depression lifted may be true, but it does not address the client's current feelings or needs. A client is taking phenelzine, Nardil, 15 milligrams PO 3 times a day. The nurse is about to administer the 1 p.m. dose when the client tells the nurse about having a throbbing headache. Which of the following should the nurse do first? 1. Give the client an analgesic, prescribed PRN. 2. Call the primary healthcare provider to report the symptom. 3. Administer the client's next dose of phenelzine. 4. Obtain the client's vital signs. The correct answer is 4. Obtain the client's vital signs. Rationale. The nurse should first take the client's vital signs because the client could be experiencing a hypertensive crisis, which requires prompt intervention. Signs and symptoms of a hypertensive crisis include occipital headache, a stiff or sore neck, nausea, vomiting, sweating, dilated pupils and photophobia, nosebleed, tachycardia, bradycardia, and constricting chest pain. Giving this client an analgesic without taking his vital signs first is inappropriate. After the client's vital signs have been obtained, then the nurse would call the primary healthcare provider to report the client's problems and vital signs. Administering the client's next dose of phenelzine for taking his vital signs could result in a dangerous situation if the client is experiencing a hypertensive crisis. The primary healthcare provider prescribes mirtazapine, Remeron, 30 milligrams PO at bedtime for a client diagnosed with depression. The nurse should 1. Give the medication as prescribed. 2. Question the primary healthcare provider's prescription. 3. Request to give the medication in the morning. 4. Give the medication in 3 divided doses. The correct answer is 1. Give the medication as prescribed. Rationale. The nurse should give the medication as prescribed. Mirtazapine is given once daily, preferably at bedtime to minimize the risk of injury resulting from postural hypotension and sedative effects. The usual dosage ranges from 15 to 45 milligrams. There is no reason to question the primary healthcare provider's prescriptions. The nurse should administer the medication as prescribed. Requesting to give the medication in 3 divided doses is inappropriate and demonstrates the nurse's lack of knowledge about the drug. A female client with severe depression and weight loss has not eaten since admission to the hospital 2 days ago. Which of the following approaches should the nurse include when developing this client's plan of care to ensure that she eats? 1. Serving the client her meal trays in her room. 2. Sitting with the client and spoon feeding if required. 3. Calling the family to bring the client food from home. 4. Explaining the importance of nutrition in recovery. The correct answer is 2. Sitting with the client and spoon feeding if required. Rationale. A depressed client commonly is not interested in eating because of the psychopathology of the disorder. Therefore, the nurse must take responsibility to ensure that the client eats, including spoon feeding the client if necessary. Serving the client her tray in her room does not ensure that she will eat. Calling the family to bring the client food from home usually is allowed, but it is still the nurse's responsibility to ensure that the client eats. Explaining the importance of nutrition in recovery is not helpful. The client may intellectually know that eating is important, but may not be interested in eating or want to eat. A client with depression who is taking doxepin, Sinequin, 100 milligrams PO, at bedtime has dizziness on arising. Which of the following suggestions is most appropriate? 1. Try taking a hot shower. 2. Get up slowly and dangle your feet before standing. 3. Stay in bed until you are feeling better. 4. You need to limit the fluids you drink. The correct answer is 2. Get up slowly and dangle your feet before standing. Rationale. Doxepin and other tricyclic antidepressants may cause postural hypotension, especially in the morning. Postural hypotension occurs because the tricyclic antidepressant inhibits the body's natural vasoconstrictive reaction when a person stands. The nurse regularly monitors the client's vital signs, both lying and standing. The nurse should instruct the client to rise slowly and dangle his feet before standing. Advising the client to take a hot shower is detrimental to the client's safety. Heat causes vasodilation, which could further exacerbate the dizziness, placing the client at risk for falls and subsequent injury. Telling the client to stay in bed until he is feeling better is not helpful and is impractical. The client with depression would rather stay in bed and withdraw from others. Placing the client on fluid restriction is detrimental to the client with depression whose fluid and food intake may be inadequate. After administering a prescribed medication to a client who becomes restless at night and has difficulty falling asleep, which of the following nursing actions is most appropriate? 1. Sitting quietly with the client at the bedside until the medication takes effect. 2. Engaging the client in interaction until the client falls asleep. 3. Reading to the client with the lights turned down low. 4. Encouraging the client to watch television until the client feels sleepy. The correct answer is 1. Sitting quietly with the client at the bedside until the medication takes effect. Rationale. To promote adequate rest, 6 to 8 hours per night, and to eliminate hypersomnia, the nurse should sit with the client at the bedside until the medication takes effect. The presence of a caring nurse provides the client with comfort and security and helps to decrease the client's anxiety. Engaging the client in interaction until the client falls asleep, reading to the client, or encouraging the client to watch television may be too stimulating for the client, consequently increasing rather than decreasing the client's restlessness. When assessing a client who is receiving tricyclic antidepressant therapy, which of the following should alert the nurse to the possibility that the client is experiencing anticholinergic effects? 1. Tremors and cardiac arrhythmias. 2. Sedation and delirium. 3. Respiratory depression and convulsions. 4. Urine retention and blurred vision. The correct answer is 4. Urine retention and blurred vision. Rationale. Anticholinergic effects, which result from blockage of the parasympathetic nervous system, include urine retention, blurred vision, dry mouth, and constipation. Tremors and cardiac arrhythmias are possible side effects, but they are caused by increased norepinephrine availability. Sedation and delirium are not anticholinergic effects. Sedation may be a therapeutic effect because many clients with depression experience agitation and insomnia. Delirium, typically not a side effect, would indicate toxicity, especially in elderly clients. Respiratory depression, convulsions, ataxia, agitation, stupor, and coma indicate tricyclic antidepressant toxicity. Which of the following behaviors exhibited by a client with depression should lead the nurse to determine that the client is ready for discharge? 1. Interactions with staff and peers. 2. Sleeping for 4 hours in the afternoon and 4 hours at night. 3. Verbalization of feeling in control of self and situations. 4. Statements of dissatisfaction over not being able to perform at work. The correct answer is 3. Verbalization of feeling in control of self and situations. Rationale. The client who verbalizes feeling in control of self and situations no longer feels powerless to affect an outcome, but realizes that one's actions can have an impact on self and situations. It is common for the client with depression to feel powerless to affect an outcome and to feel a lack of control over a situation. Although interacting with staff and peers is a positive action, the client could be conversing in a negative or non-therapeutic manner. Sleeping 4 hours in the afternoon and 4 hours at night is evidence of symptomatology and does not indicate improvement or recovery. Verbalizing dissatisfaction over not being able to perform at work indicates that the client is most likely focusing on shortcomings and powerlessness. The client with depression who is taking imipramine, tofranil, states to the nurse, "My doctor wants me to have an electrocardiogram in 2 weeks, but my heart is fine." Which response by the nurse is most appropriate? 1. It's routine practice to have ECGs periodically because there is a slight chance that the drug may affect the heart. 2. It's probably a precautionary measure because I'm not aware that you have a cardiac condition. 3. Try not to worry too much about this. Your doctor is just being very thorough in monitoring your condition. 4. You had an ECG before you were prescribed imipramine, and the procedure will be the same. The correct answer is 1. It's routine practice to have ECGs periodically because there is a slight chance that the drug may affect the heart. Rationale. Telling the client that ECGs are done routinely for all clients taking imipramine, a tricyclic antidepressant, is an honest and direct response. Additionally, it provides some reassurance for the client. Commonly, a client with depression will ruminate, leading to needless increased anxiety. Tricyclic antidepressants may cause tachycardia, ECG changes, and cardiotoxicity. Telling the client that it's probably a precautionary measure because the nurse is not aware of a cardiac condition instills doubt and may cause undue anxiety for the client. Telling the client not to worry because the doctor is very thorough dismisses the client's concern and does not give the client adequate information. Explaining that the client had an ECG before initiating therapy with imipramine and that the procedure will be the same does not answer the client's question. Crackles heard on lung auscultation indicate which of the following? 1. Cyanosis. 2. Bronchospasm. 3. Airway narrowing. 4. Fluid-filled alveoli. The correct answer is 4. Fluid-filled alveoli. Rationale. Crackles are auscultated over fluid-filled alveoli. Crackles heard on lung auscultation do not have to be associated with cyanosis. Bronchospasm and airway narrowing generally are associated with wheezing sounds. Which of the following is an expected outcome when a client is receiving an IV administration of furosemide? 1. Increased blood pressure. 2. Increased urine output. 3. Decreased pain. 4. Decreased premature ventricular contractions. The correct answer is 2. Increased urine output. Rationale. Furosemide is a loop diuretic that acts to increase urine output. Furosemide does not increase blood pressure, decrease pain, or decrease arrhythmias. Which of the following comments indicates that a client understands the nurse's teaching about sertraline? 1. Zoloft will probably cause me to gain weight. 2. This medicine can cause decreased libido. 3. Dry mouth is a permanent side effect of Zoloft. 4. I can take my medicine with St. John's wort. The correct answer is 2. This medicine can cause decreased libido. Rationale. Sertraline, like other selective serotonin reuptake inhibitors, SSRIs, can cause decreased libido. SSRIs do not typically cause weight gain but may cause loss of appetite and weight loss. Dry mouth is a possible side effect, but it is temporary. The client should be told to take sips of water, suck on ice chips, or use sugarless gum or candy. St. John's wort should not be taken with SSRIs because a severe reaction could occur. The nurse is developing a teaching plan for a client who will be starting a prescription for Zocor, simvastatin, 40 milligrams per day. The nurse should instruct the client about which of the following? Select all that apply. 1. Take once a day in the morning. 2. If you miss a dose, take it when you remember it, but do not double the dose if you do not remember to take it until it is time for your next dose. 3. Limit greens such as lettuce in the diet to prevent bleeding. 4. Be sure to take the pill with food. 5. Report muscle pain or tenderness to your healthcare provider. 6. Continue to follow a diet that is low in saturated fats. The correct answers are 2. If you miss a dose, take it when you remember it, but do not double the dose if you do not remember to take it until it is time for your next dose. 5. Report muscle pain or tenderness to your healthcare provider. And 6. Continue to follow a diet that is low in saturated fats. Rationale. Zocor, simvastatin, is used in combination with diet and exercise to decrease elevated total cholesterol. The client should take Zocor in the evening, and the nurse should instruct the client that if a dose is missed, to take it as soon as remembered, but not to take at the same time as the next scheduled dose. It is not necessary to take the pill with food. The client does not need to limit greens. Limiting greens is appropriate for clients taking Coumadin, but the nurse should instruct the client to avoid grapefruit and grapefruit juice, which can increase the amount of the drug in the bloodstream. A serious side effect is myopathy, and the client should report muscle pain or tenderness to the healthcare provider. A client has had a pulmonary artery catheter inserted. In performing hemodynamic monitoring with a catheter, the nurse will wedge the catheter to gain information about which of the following? 1. Cardiac output. 2. Right atrial blood flow. 3. Left end diastolic pressure. 4. Cardiac index. The correct answer is 3. Left end diastolic pressure. Rationale. When wedged, the catheter is pointing indirectly at the left end diastolic pressure. The pulmonary artery wedge pressure is measured when the tip of the catheter is slowing inflated and allowed to wedge into a branch of the pulmonary artery. Once the balloon is wedged, the catheter reads the pressure in front of the balloon. During diastole, the mitral valve is open, reflecting left ventricular end diastolic pressure. Cardiac output is the amount of blood ejected by the heart in 1 minute and is determined through thermodilution and not wedge pressure. Cardiac index is calculated by dividing the client's cardiac output by the client's body surface area and is considered a more accurate reflection of the individual client's cardiac output. Right atrial blood pressure is not measured with the pulmonary artery catheter. A client with angina is taking nifedipine. The nurse should teach the client to 1. Monitor blood pressure monthly. 2. Perform daily weights. 3. Inspect gums daily. 4. Limit intake of green leafy vegetables. The correct answer is 3. Inspect gums daily. Rationale. The client taking nifedipine should inspect the gums daily to monitor for gingival hyperplasia. This is an uncommon adverse effect, but one that requires monitoring and intervention if it occurs. The client taking nifedipine might be taught to monitor blood pressure, but more often than monthly. These clients would not generally need to perform daily weights or limit intake of green leafy vegetables. After a myocardial infarction, the hospitalized client is taught to move the legs while resting in bed. The expected outcome of this exercise is to 1. Prepare the client for ambulation. 2. Promote urinary and intestinal elimination. 3. Prevent thrombophlebitis and blood clot formation. 4. Decrease the likelihood of pressure ulcer formation. The correct answer is 3. Prevent thrombophlebitis and blood clot formation. Rationale. Encouraging the client to move the legs while in bed is a preventive strategy taught to all clients who are hospitalized and on bed rest to promote venous return. The muscular action aids in venous return and prevents venous stasis in the lower extremities. These exercises are not intended to prepare the client for ambulation. These exercises are not associated with promoting urinary and intestinal elimination. These exercises are not performed to decrease the risk of pressure ulcer formation. How should the nurse instruct the client with unstable angina to use sublingual nitroglycerin tablets when chest pain occurs? 1. Sit down and then take one tablet every 2 to 5 minutes until the pain stops. 2. Sit down and then take one tablet and rest for 15 minutes. Call the physician if pain persists after 15 minutes. 3. Sit down and then take one tablet. Then if the pain persists, take additional 2 tablets in 5 minutes. Call the physician if pain persists after 15 minutes. 4. Sit down and then take one tablet. If pain persists after 5 minutes, call 911. The correct answer is 4. Sit down and then take one tablet. If pain persists after 5 minutes, call 911. Rationale. The nurse should instruct the client that correct protocol for using sublingual nitroglycerin involves immediate administration when chest pain occurs. Sublingual nitroglycerin appears in the bloodstream within 2 to 3 minutes and is metabolized within about 10 minutes. The client should sit down and place the tablet under the tongue. If the chest pain is not relieved within 5 minutes, the client should call 911. Although some physicians may recommend taking a second or third tablet spaced 5 minutes apart and then calling for emergency assistance, it is not appropriate to take 2 tablets at once. Nitroglycerin acts within 2 to 3 minutes, and the client should not wait 15 minutes to take further action. The client should call 911 to obtain emergency help rather than calling the physician. Which of the following is the most appropriate diet for a client during the acute phase of myocardial infarction? 1. Liquids as desired. 2. Small, easily digested meals. 3. 3 regular meals per day. 4. Nothing by mouth. The correct answer is 2. Small, easily digested meals. Rationale. Recommended dietary principles in the acute phase of MI include avoiding large meals because small, easily digested foods are better tolerated. Fluids are given according to the client's needs, and sodium restrictions may be prescribed, especially for clients with manifestations of heart failure. Cholesterol restrictions may be prescribed as well. Clients are not prescribed diets of liquids only or restricted to nothing by mouth unless their condition is very unstable. A client has a throbbing headache when nitroglycerin is taken for angina. The nurse should instruct the client that 1. Acetaminophen, Tylenol, or ibuprofen, Advil can be taken for this common side effect. 2. Nitroglycerin should be avoided if the client is experiencing this serious side effect. 3. Taking the nitroglycerin with a few glasses of water will reduce the problem. 4. The client should lie in a supine position to alleviate the headache. The correct answer is 1. Acetaminophen, Tylenol, or ibuprofen, Advil can be taken for this common side effect. Rationale. Headache is a common side effect of nitroglycerin that can be alleviated with aspirin, acetaminophen, or ibuprofen. The sublingual nitroglycerin needs to be absorbed in the mouth, which will be disrupted with drinking. Lying flat will increase blood flow to the head and may increase pain and exacerbate other symptoms, such as shortness of breath. The nurse is caring for a client who recently experienced a myocardial infarction and has been started on clopidogrel, Plavix. The nurse should develop a teaching plan that includes which of the following points? Select all that apply. 1. The client should report unexpected bleeding or bleeding that lasts a long time. 2. The client should take Plavix with food. 3. The client may bruise more easily and may experience bleeding gums. 4. Plavix works by preventing platelets from sticking together and forming a clot. 5. The client should drink a glass of water after taking Plavix. The correct answers are 1. The client should report unexpected bleeding or bleeding that lasts a long time. 3. The client may bruise more easily and may experience bleeding gums. And 4. Plavix works by preventing platelets from sticking together and forming a clot. Rationale. Plavix is generally well absorbed and may be taken with or without food. It should be taken at the same time every day, and while food may help prevent potential GI upset, food has no effect on absorption of the drug. Bleeding is the most common adverse effect of Plavix. The client must understand the importance of reporting any unexpected, prolonged, or excessive bleeding, including blood in urine or stool. Increased bruising and bleeding gums are possible side effects of Plavix. The client should be aware of this possibility. Plavix is an antiplatelet agent used to prevent clot formation in clients that have experienced or are at risk for myocardial infarction, ischemic stroke, peripheral artery disease, or acute coronary syndrome. It is not necessary to drink a glass of water after taking Plavix. As an initial step in treating a client with angina, the physician prescribes nitroglycerin tablets, 0.3 milligrams given sublingually. This drug's principal effects are produced by 1. Antispasmodic effects on the pericardium. 2. Causing an increased myocardial oxygen demand. 3. Vasodilation of peripheral vasculature. 4. Improved conductivity in the myocardium. The correct answer is 3. Vasodilation of peripheral vasculature. Nitroglycerin produces peripheral vasodilation, which reduces myocardial oxygen consumption and demand. Vasodilation in coronary arteries and collateral vessels may also increase blood flow to the ischemic areas of the heart. Nitroglycerin decreases myocardial oxygen demand. Nitroglycerin does not have an effect on pericardial spasticity or conductivity in the myocardium. Which client is at greatest risk for coronary artery disease? 1. A 32-year-old female with mitral valve prolapse who quit smoking 10 years ago. 2. A 43-year-old male with a family history of CAD and cholesterol level of 158. 3. A 56-year-old male with an HDL of 60 who takes atorvastatin. 4. A 65-year-old female who is obese with an LDL of 188. The correct answer is for a 65-year-old female who is obese with an LDL of 188. Rationale. The woman who is 65 years old, overweight, and has an elevated LDL is at greatest risk. The combination of postmenopausal obesity and high LDL places this client at greatest risk. Which of the following is not a risk factor for the development of atherosclerosis? 1. Family history of early heart attack. 2. Late onset of puberty. 3. Total blood cholesterol level greater than 220 milligrams per deciliter. 4. Elevated fasting blood glucose concentration. The correct answer is 2. Late onset of puberty. Rationale. Late onset of puberty is not generally considered to be a risk factor for the development of atherosclerosis. Risk factors for atherosclerosis include family history of atherosclerosis, cigarette smoking, hypertension, high blood cholesterol level, male gender, diabetes mellitus, obesity, and physical inactivity. A middle-aged adult with a family history of CAD has the following: total cholesterol 198, LDL cholesterol 120, HDL cholesterol 58, triglycerides 148, blood sugar 102, and C-reactive protein 4.2. The healthcare provider prescribes a statin medication and aspirin. The client asks the nurse why these medications are needed. Which is the best response by the nurse? 1. The labs indicate severe hyperlipidemia and the medications will lower your LDL, along with a low-fat diet. 2. The triglycerides are elevated and will not return to normal without these medications. 3. The CRP is elevated, indicating inflammation seen in cardiovascular disease, which can be lowered by the medications prescribed. 4. These medications will reduce the risk of type 2 diabetes. The correct answer is 3. The CRP is elevated, indicating inflammation seen in cardiovascular disease, which can be lowered by the medications prescribed. Rationale. CRP is a marker of inflammation and is elevated in the presence of cardiovascular disease. The high-sensitivity CRP is the blood test for greater accuracy in measuring the CRP to evaluate cardiovascular risk. The family history, postmenopausal age, LDL above optimum levels, and elevated CRP place the client at risk of CAD. Statin medications can decrease LDL, whereas statins and aspirin can reduce CRP and decrease the risk of MI and stroke. The blood sugar is within normal limits. The client is scheduled for a percutaneous transluminal coronary angioplasty to treat angina. Priority goals for the client immediately after PTCA should include 1. Minimizing dyspnea. 2. Maintaining adequate blood pressure control. 3. Decreasing myocardial contractility. 4. Preventing fluid volume deficit. The correct answer is 4. Preventing fluid volume deficit. Rationale. Because the contrast medium used in PTCA acts as an osmotic diuretic, the client may experience diuresis with resultant fluid volume deficit after the procedure. Additionally, potassium levels must be closely monitored because the client may develop hypokalemia due to the diuresis. Dyspnea would not be anticipated after this procedure. Maintaining adequate blood pressure control should not be a problem after the procedure. Increased myocardial contractility would be a goal, not decreased contractility. The client has been managing angina episodes with nitroglycerin. Which of the following indicate the drug is effective? 1. Decreased chest pain. 2. Increased blood pressure. 3. Decreased blood pressure. 4. Decreased heart rate. The correct answer is 1. Decreased chest pain. Rationale. Nitroglycerin acts to decrease myocardial oxygen consumption. Vasodilation makes it easier for the heart to eject blood, resulting in decreased oxygen needs. Decreased oxygen demand reduces pain caused by heart muscle not receiving sufficient oxygen. While blood pressure may decrease ever so slightly due to the vasodilation effects of nitroglycerin, it is only secondary and not related to the angina the patient is experiencing. Increased blood pressure would mean the heart would work harder, increasing oxygen demand and thus angina. Decreased heart rate is not an effect of nitroglycerin. The physician refers the client with unstable angina for a cardiac catheterization. The nurse explains to the client that this procedure is being used in this specific situation to 1. Open and dilate blocked coronary arteries. 2. Assess the extent of arterial blockage. 3. Bypass obstructed vessels. 4. Assess the functional adequacy of the valves and heart muscle. The correct answer is 2. Assess the extent of arterial blockage. Rationale. Cardiac catheterization is done in clients with angina primarily to assess the extent and the severity of the coronary artery blockage. A decision about medical management, angioplasty, or coronary artery bypass surgery will be based on the catheterization results. Coronary bypass surgery would be used to bypass obstructed vessels. Although cardiac catheterization can be used to assess the functional adequacy of the valves and heart muscle. In this case, the client has unstable angina and therefore would need the procedure to assess the extent of arterial blockage. If the client displays risk factors for coronary artery disease, such as smoking cigarettes, eating a diet high in saturated fat, or leading a sedentary lifestyle, techniques of behavior modification may be used to help the client change the behavior. The nurse can best reinforce new adaptive behaviors by 1. Explaining how the risk factor behavior leads to poor health. 2. Withholding praise until the new behavior is well established. 3. Rewarding the client whenever the acceptable behavior is performed. 4. Instilling mild fear into the client to extinguish the behavior. The correct answer is 3. Rewarding the client whenever the acceptable behavior is performed. Rationale. A basic principle of behavior modification is that behavior that is learned and continued is behavior that has been rewarded. Other reinforcement techniques have not been found to be as effective as reward. Which of the following symptoms should the nurse teach the client with unstable angina to report immediately to the physician? 1. A change in the pattern of the chest pain. 2. Pain during sexual activity. 3. Pain during an argument. 4. Pain during or after a physical activity. The correct answer is 1. A change in the pattern of the chest pain. Rationale. The client should report a change in the pattern of chest pain. It may indicate increasing severity of coronary artery disease. Pain occurring during stress or sexual activity would not be unexpected, and the client may be instructed to take nitroglycerin to prevent this pain. Pain during or after an activity, such as lawn mowing, also would not be unexpected. The client may be instructed to take nitroglycerin to prevent this pain or may be restricted from doing such activities. Alteplase recombinant or tissue plasminogen activator, TPA, a thrombolytic enzyme, is administered during the first 6 hours after onset of myocardial infarction to 1. Control chest pain. 2. Reduce coronary artery vasospasm. 3. Control the arrhythmias associated with MI. 4. Revascularize the blocked coronary artery. The correct answer is 4. Revascularize the blocked coronary artery. Rationale. The thrombolytic agent TPA, administered intravenously, lyses the clot blocking the coronary artery. The drug is most effective when administered within the first 6 hours after onset of MI. The drug does not reduce coronary artery vasospasm. Nitrates are used to promote vasodilation. Arrhythmias are managed by antiarrhythmic drugs. Surgical approaches are used to open the coronary artery and reestablish a blood supply to the area. The client who experiences angina has been told to follow a low cholesterol diet. Which of the following meals would be best? 1. Hamburger, salad, and milkshake. 2. Baked liver, green beans, and coffee. 3. Spaghetti with tomato sauce, salad, and coffee. 4. Fried chicken, green beans, and skim milk. The correct answer is 3. Spaghetti with tomato sauce, salad, and coffee. Rationale. Pasta, tomato sauce, salad, and coffee would be the best selection for the client following a low cholesterol diet. Hamburgers, milkshakes, liver, and fried foods tend to be high in cholesterol. After the administration of TPA, the nurse should 1. Observe the client for chest pain. 2. Monitor for fever. 3. Review the 12-lead electrocardiogram, ECG. 4. Auscultate breath sounds. The correct answer is 1. Observe the client for chest pain. Rationale. Although monitoring the 12-lead ECG and monitoring breath sounds are important, observing the client for chest pain is the nursing assessment priority because closure of the previously obstructed coronary artery may recur. Clients who receive TPA frequently receive heparin to prevent closure of the artery after administration of TPA. Careful assessment for signs of bleeding and monitoring of partial thromboplastin time are essential to detect complications. Administration of TPA should not cause fever. Following diagnosis of angina pectoris, a client reports being unable to walk up 2 flights of stairs without pain. Which of the following measures would most likely help the client prevent this problem? 1. Climb the steps early in the day. 2. Rest for at least an hour before climbing the stairs. 3. Take a nitroglycerin tablet before climbing the stairs. 4. Lie down after climbing the stairs. The correct answer is 3. Take a nitroglycerin tablet before climbing the stairs. Rationale. Nitroglycerin may be used prophylactically before stressful physical activities, such as stair climbing, to help the client remain pain-free. Climbing the stairs early in the day would have no impact on decreasing pain episodes. Resting before or after an activity is not as likely to help prevent an activity-related pain episode. When monitoring a client who is receiving tissue plasminogen activator, TPA, the nurse should have resuscitation equipment available because reperfusion of the cardiac tissue can result in which of the following? 1. Cardiac arrhythmias. 2. Hypertension. 3. Seizure. 4. hypothermia. The correct answer is 1. Cardiac arrhythmias. Rationale. Cardiac arrhythmias are commonly observed with administration of TPA. Cardiac arrhythmias are associated with reperfusion of the cardiac tissue. Hypotension is commonly observed with administration of TPA. Seizures and hypothermia are not generally associated with reperfusion of the cardiac tissue. The nurse is assessing an older adult with a pacemaker who leads a sedentary lifestyle. The client reports being unable to perform activities that require physical exertion. The nurse should further assess the client for which of the following? 1. Left ventricular atrophy. 2. Irregular heartbeats. 3. Peripheral vascular occlusion. 4. Pacemaker placement. The correct answer is 1. Left ventricular atrophy. Rationale. In older adults who are less active and do not exercise the heart muscle, atrophy can result. Disuse or deconditioning can lead to abnormal changes in the myocardium of the older adult. As a result, under sudden emotional or physical stress, the left ventricle is less able to respond to the increased demands on the myocardial muscle. Decreased cardiac output, cardiac hypertrophy, and heart failure are examples of the chronic conditions that may develop in response to inactivity, rather than in response to the aging process. Irregular heartbeats are generally not associated with an older sedentary adult's lifestyle. Peripheral vascular occlusion or pacemaker placement should not affect response to stress. Prior to administering tissue plasminogen activator, TPA, the nurse should assess the client for which of the following contradictions to administering the drug? 1. Age greater than 60 years. 2. History of cerebral hemorrhage. 3. History of heart failure. 4. Cigarette smoking. The correct answer is 2. History of cerebral hemorrhage. Rationale. A history of cerebral hemorrhage is a contraindication to administration of TPA because the risk of hemorrhage may be further increased. Age greater than 60 years, history of heart failure, and cigarette smoking are not contraindications. A 68-year-old client on day 2 after hip surgery has no cardiac history but reports having chest heaviness. The first nursing action should be to 1. Inquire about the onset, duration, severity, and precipitating factors of the heaviness. 2. Administer oxygen via nasal cannula. 3. Offer pain medication for the chest heaviness. 4. Inform the physician of the chest heaviness. The correct answer is 1. Inquire about the onset, duration, severity, and precipitating factors of the heaviness. Rationale. Further assessment is needed in this situation. It is premature to initiate other actions until further data have been gathered. Inquiring about the onset, duration, location, severity, and precipitating factors of the chest heaviness will provide pertinent information to convey to the physician. A client has driven himself to the emergency department. He is 50 years old, has a history of hypertension, and informs the nurse that his father died from a heart attack at age 60. The client has indigestion. The nurse connects him to an electrocardiogram monitor and begins administering oxygen at 2 liters per minute per nasal cannula. The nurse's next action should be to 1. Call for the physician. 2. Start an IV infusion. 3. Obtain a portable chest radiograph. 4. Draw blood for laboratory studies. The correct answer is 2. Start an IV infusion. Rationale. Advanced Cardiac Life Support recommends that at least 1 or 2 IV lines be inserted in one or both of the anticubal spaces. Calling the physician, obtaining a portable chest radiograph, and drawing blood for the laboratory are important but secondary to starting the IV line. A client with major depression and psychotic features is admitted involuntarily to the hospital. He will not eat because his bowels have turned to jelly, which the client states is punishment for his wickedness. The client requests to leave the hospital. The nurse denies the request because commitment papers have been initiated by the primary healthcare provider. Which of the following should the nurse identify as a criterion for the client to be legally committable? 1. Evidence of psychosis. 2. Being gravely disabled. 3. Risk of harm to self or others. 4. Diagnosis of mental illness. The correct answer is 2. Being gravely disabled. Rationale. Criteria for commitment include being gravely disabled and posing a harm to self or others. This client is not threatening to harm himself or to harm others. The client is gravely disabled because of his inability to care for himself, namely, not eating because of his delusion. Evidence of psychosis or psychotic symptoms or diagnosis of a mental illness alone does not make the client legally eligible for commitment. The nurse in the emergency department is preparing to administer alteplase to a client whose initial symptoms of a stroke began 2 hours ago. Which interventions should the nurse implement? Select all that apply. 1. Check the client's armband for allergies. 2. Check the results of the client's CT scan of the brain. 3. Teach the client this medication dissolves clots. 4. Dilute the medication with normal saline and administer over 2 minutes. The correct answers are 1. Check the client's armband for allergies, and 2. Check the results of the client's CT scan of the brain. Rationale. The nurse should always check the client's armband prior to administering medication. There are 3 types of strokes: thrombotic, embolic, and hemorrhagic. The nurse must know that the client has not had a hemorrhagic stroke before hanging a medication that destroys clots. Administering alteplase, a thrombolytic medication, to a client who has had a hemorrhagic stroke can result in the client's death. Teaching the client can be done after the medication has been administered. Patient teaching is generally secondary to the immediate, life-saving administration of this time-critical drug. Informed consent is necessary, but detailed teaching can wait until the drug is safely infusing or later, and the patient may be too acutely ill or neurologically impaired to fully grasp the information at the moment of administration. The client is having status epilepticus and is prescribed IV diazepam. The client has an IV of D5W 75 milliliters per hour in the right arm and a saline lock in the left arm. Which intervention should the nurse implement? 1. Dilute the diazepam and administer over 5 minutes via the existing IV. 2. Do not dilute the medication and administer at the port closest to the client. 3. Question the order because diazepam cannot be administered with D5W. 4. Inject 3 milliliters of normal saline in the saline lock and administer diazepam undiluted. The correct answer is for inject 3 milliliters of normal saline in the saline lock and administer diazepam undiluted. Rationale. The nurse should administer the diazepam, a benzodiazepine, undiluted through the saline lock. Diazepam is oil-based and should not be diluted. It should not be administered in an existing IV line if another option is available. The nurse does not need to question the order because there is an existing saline lock. The client diagnosed with a stroke has been prescribed phenytoin. Which statement explains the scientific rationale for prescribing this medication? 1. The client's stroke was caused by some damage to cerebral tissue. 2. The stroke caused damage to the brain tissue that could result in seizures. 3. Hemorrhagic strokes leave residual blood in the brain that causes seizures. 4. This medication can help the client with cognitive deficits think more clearly. The correct answer is 2. The stroke caused damage to the brain tissue that could result in seizures. Rationale. Stroke caused loss of function in areas of the brain leads to a problem with nerve impulse transmission. This blocked transmission can initiate a seizure. Phenytoin is an anticonvulsant. Strokes cause damage to the cerebral tissue. The brain does not cause the damage to itself. If the client survives a hemorrhagic stroke, the body will reabsorb the blood. There should not be any residual blood. Anticonvulsants do not increase cognitive ability. The nurse in the ICU is caring for a client diagnosed with a left cerebral artery thrombotic stroke who received a thrombolytic medication in the ED. Which intervention should be implemented? 1. Administer oral ticlopidine. 2. Place the client in the Trendelenburg position. 3. Keep the client turned to the right side and high Fowler's position. 4. Monitor heparin infusion. The correct answer is 4. Monitor heparin infusion. Rationale. Ticlopidine, an antiplatelet, may be ordered in the future once the cause of the thrombus is determined, but this would not be ordered in the ICU. The Trendelenburg position is head down and would increase intracranial pressure. There is no reason to restrict the client to lying on the right side, and high Fowler's is sitting upright. This would be a difficult position for the client to maintain. The client should have the head of the bed elevated approximately 30 degrees to decrease intracranial pressure by gravity drainage. The anticoagulant medication heparin is administered to prevent clot reformation after lysis of the clot by the thrombolytic, and its infusion should be monitored. The client newly diagnosed with a seizure disorder also has type 2 diabetes. The HCP prescribes phenytoin for the client. Which intervention should the nurse implement? 1. Instruct the client to monitor his or her blood glucose more closely. 2. Explain that the phenytoin will not affect the client's anti-diabetic medication. 3. Discuss the need to discontinue oral hypoglycemic medication and take insulin. 4. Call the HCP to discuss prescribing the phenytoin. The correct answer is 1. Instruct the client to monitor his or her blood glucose more closely. Rationale. Serum glucose must be monitored more closely because phenytoin may inhibit insulin release, thus causing an increase in glucose level. Options 2 is not a true statement. Diazepam may affect the client's anti-diabetic medication. Option 3 is not a true statement. The client can still take oral hypoglycemic medications. The nurse should call and discuss any questionable medication with the HCP, but there is no reason to discuss diazepam, a benzodiazepine being prescribed for a client with type 2 diabetes. The nurse is preparing to administer an oral medication to a client diagnosed with a stroke. Which intervention should the nurse implement? Select all that apply. 1. Crush all oral medications and place them in pudding. 2. Elevate the head 30 degrees. 3. Ask the client to swallow a drink of water. 4. Have suction equipment at the bedside. 5. Insert a nasogastric tube to administer medications. The correct answers are 1. Crush all oral medications and place them in pudding, and 3. Ask the client to swallow a drink of water. Rationale. Some medications can be crushed and administered in pudding if the client has difficulty swallowing, but the nurse needs to be aware that enteric-coated or time-release medications should not be crushed. The client's ability to swallow must be assessed before attempting to administer any oral medication. Water is the best fluid to use because it will not damage the lungs if aspirated. The head of the bed should be elevated to 90 degrees when the client is swallowing food or medications. Equipment is usually charged to the client. The nurse should first determine if suction equipment is needed prior to setting it up. The client's medications are being administered orally. Therefore, the nurse should not insert a nasogastric tube. The female client diagnosed with epilepsy tells the nurse, "I am very scared to get pregnant since I am taking medication for my epilepsy." Which statement is the nurse's best response? 1. You are scared because you take medication for your epilepsy. 2. Can you tell me more about what is concerning you? 3. You should not get pregnant when you are taking anticonvulsants. 4. Have you discussed your concerns with your HCP? The correct answer is 2. Can you tell me more about what is concerning you? Rationale. Option 1 is a therapeutic response that is used to encourage the client to ventilate feelings, but the nurse should provide factual information to this client. The nurse should explore the reasons for the client's fears in order to be able to give her information that would help her make a decision about becoming pregnant, as many anticonvulsant medications have teratogenic properties. A female client with epilepsy can give birth to an infant without epilepsy. The client should discuss a potential pregnancy with a significant other, but this is not addressing the client's concerns. The long-term care facility nurse is caring for a client diagnosed with a cerebrovascular accident 6 months ago who has residual cognitive deficits. The HCP has ordered alprazolam to be administered at bedtime. Which interventions should the nurse initiate for this client? Select all that apply. 1. offer toileting every 2 hours. 2. Move the client close to the nurse's station. 3. Administer the medication at 2100. 4. Administer the medication with a full glass of water. 5. Do not administer if the client's apical pulse is less than 60 beats per minute. The correct answers are 1. Offer toileting every 2 hours. 2. Move the client close to the nurse's station. And 3. Administer the medication at 2100. Rationale: alprazolam, an anti-anxiety medication, has a side effect of drowsiness, which is why the HCP chose this medication for the client, to help the client rest at night. The client has cognitive deficits and should be on fall precautions. So it is hoped that assisting the client to the bathroom every 2 hours will prevent the client from falling while trying to get to the bathroom. The client at risk for falling should be as near the nursing station as possible. This allows the staff to keep a closer watch on the client. The medication is ordered for bedtime, usually 2100 in most healthcare facilities. Giving the medication with a full glass of water would increase the client's need to get up during the night to use the bathroom, increasing the risk of falling. This medication does not require the apical pulse being monitored prior to administering the medication. The nurse is caring for a client diagnosed with a hemorrhagic stroke. Which medication should the nurse question administering? 1. Clopidogrel. 2. Mannitol. 3. Nifedipine. 4. Dexamethasone. The correct answer is 1. Clopidogrel. Rationale: the client has experienced a bleed into the cranium. Clopidogrel, an antiplatelet, interferes with the client's clotting ability. This medication should be held and discussed with the HCP. There is no reason to question giving a medication that will decrease intracranial pressure. Mannitol is the diuretic of choice for this client. It is an osmotic diuretic, which has the best effect on the cranial tissues. Nifedipine is a calcium channel blocker that will decrease the client's blood pressure, which is elevated in clients with increased intracranial pressure. Dexamethasone, a glucocorticoid, will decrease edema, resulting in decreased intracranial pressure. The client newly diagnosed with epilepsy is prescribed an anticonvulsant medication. Which information should the nurse tell the client? 1. The medication dosage will start low and gradually increase over a few weeks. 2. The dosage prescribed initially will be the dosage prescribed for the rest of your life. 3. The HCP will prescribe a loading dose and decrease dosage gradually. 4. The dose of medication will be adjusted monthly until a serum drug level is obtained. The correct answer is 1. The medication dosage will start low and gradually increase over a few weeks. Rationale: anticonvulsant dosages usually start low and gradually increase over a period of weeks until the serum drug level is within therapeutic range or the seizures stop. It is incorrect to state that the dosage prescribed will be the dosage for the rest of the client's life, but it is correct to state that the client will most likely be on the medication for the rest of his or her life. The medication is started in low dosages and gradually increased. The dose of medication will be adjusted until a serum drug level is reached, but it will be more frequently than monthly. The elderly client diagnosed with a stroke is being discharged. When preparing the discharge instructions, the nurse notes many medications that are ordered to be taken at different times of the day. Which intervention should the nurse implement first? 1. Complete a comprehensive chart for the client to use. 2. Refer the client to a home healthcare agency for follow-up. 3. Teach the client to return to the HCP office for follow-up. 4. Discuss the multiple medications and times with the HCP. The correct answer is 4. Discuss the multiple medications and times with the HCP. Rationale: the client has had a stroke and may have difficulty complying with multiple medications and different administration times. Research indicates that the fewer medication administration times during the day, the better the compliance with taking the medication as ordered. The nurse should discuss simplifying the medication regimen with the HCP. Option 1 could be done if the nurse and HCP cannot simplify the medication routine. Option 2 need to be done based on the nurse's evaluation of the client's situation, but it is not the first intervention. Option 3 should be done, but it is not the first intervention and does not address the problem of many medications and multiple administration times. The nurse is preparing to administer phenytoin IV push. The client has an IV of D5W0.45 normal saline at 50 milliliters per hour. Which intervention should the nurse implement? 1. Administer the phenytoin undiluted over 5 minutes via the port closest to the client. 2. Dilute the medication with normal saline and administer over 2 minutes. 3. Flush tubing with normal saline. Administer diluted phenytoin and then flush with normal saline. 4. Insert a saline lock in the other arm and administer the medication undiluted. The correct answer is 3. Flush tubing with normal saline, administer diluted phenytoin, and then flush with normal saline. Rationale: phenytoin cannot be administered with dextrose because it will cause precipitation. Phenytoin should be diluted in a saline solution, and the IV tubing should be flushed before and after administration because a dextrose solution will cause drug precipitation. There is no reason for the nurse to cause more pain to the client by starting a saline lock because the IV tubing is already in place and can be flushed before and after the administration of phenytoin. Anytime a nurse administers an IV push medication, the nurse should dilute the medication. This causes less pain for the client, helps prevent infiltration of the vein, and allows the nurse to administer the medication over the correct amount of time if it is diluted to a 10 milliliters bolus. The client diagnosed with chronic hypertension is prescribed furosemide and enalapril. The client's blood pressures for the last 3 weeks have averaged 178/95, and the HCP has added atenolol to the client's current medication regimen. Which statement is the scientific rationale for including this medication in the client's regimen? 1. Achieving a lower average blood pressure will help to prevent a stroke. 2. The other medications are not effective without the addition of atenolol. 3. The atenolol will potentiate the effects of loop diuretics. 4. The HCP will taper off the enalapril and eventually discontinue it. The correct answer is 1. Achieving a lower average blood pressure will help to prevent a stroke. Rationale: hypertension is a risk factor for developing a stroke. Some clients require multiple medications to control their hypertension. If option 2 was true, then atenolol would be the only medication the client needs. Beta blockers are frequently used in combination with other antihypertensive medications to control a client's blood pressure. Atenolol, a beta blocker, does not potentiate the effectiveness of loop diuretics. Beta blockers, not ACE inhibitors, enalapril, must be tapered off when discontinuing them to prevent rebound cardiac dysrhythmias. The HCP is adding the beta blocker to the current medications. The 55-year-old African-American male client presents to the emergency department with blurred vision, slurred speech, and left-sided weakness. The client has a history of hypertension and benign prostatic hypertrophy. Which statement regarding the client's medications should the nurse ask at this time? 1. Have you been taking over the counter herbs to treat the BPH? 2. Do you take an aspirin every day to prevent heart attacks and strokes? 3. Do you eat green, leafy vegetables frequently? 4. Have you been taking medications routinely to control the hypertension? The correct answer is 4. Have you been taking medications routinely to control the hypertension? Rationale: many medications for hypertension have the adverse effect of causing erectile dysfunction, which many men are hesitant to discuss with their HCP, and a man may simply stop taking the medication to avoid the side effect. The nurse should assess how the client has been controlling his hypertension and ask specifically about erectile dysfunction related to hypertensive medication. Hypertension is a risk factor for developing other cardiovascular diseases, including stroke. This client has 2 risk factors for developing a stroke: hypertension and his racial background. The nurse should ask all clients about taking OTC preparations when being admitted, but this question would have no bearing on the clients presenting symptoms of a stroke. The client has symptoms of a stroke. Whether he was taking an aspirin to prevent a potential problem is irrelevant. The client has a problem at this time. Green, leafy vegetables are high in vitamin K, the antidote for Coumadin. The client has no reason to be taking an anticoagulant at this time. The 44-year-old female client presents to the emergency department diagnosed with a stroke. Which of the client's current medication regimen is a risk factor for developing a stroke? 1. Propranolol. 2. Furosemide. 3. Estradiol/norgestimate. 4. Metformin. The correct answer is 3. Estradiol/norgestimate. Rationale: propranolol, a beta blocker, is administered for cardiac dysrhythmias and hypertension and for migraine headache prophylaxis. The medication could help prevent a stroke by lowering the blood pressure. Furosemide is a loop diuretic. Loop diuretics have an indirect ability to lower the blood pressure by decreasing the volume of fluid in the body. This would decrease the risk of a stroke. Estradiol/norgestimate is a combination hormone used to prevent conception. Combination oral contraceptives have been associated with venous and arterial thromboembolism, pulmonary embolism, myocardial infarction, and thrombotic stroke. Adverse reaction to metformin glucophage, a biguanide, is lactic acid buildup, not stroke.
An older adult woman who has left-sided paralysis because of a brain attack is being cared for by a daughter in the home in which the daughter lives with her husband. The home care nurse interviews each member of the family separately, based on the significant information in each interview, which is the most important initial nursing intervention. 1. Be sensitive to the client's cultural beliefs. 2. Arrange respite care for the client's daughter. 3. Reinforce the daughter's responsibility to care for her mother. 4. Encourage the husband to help his wife with the care of his mother-in-law. The correct answer is 1. Be sensitive to the client's cultural beliefs. Rationale: beliefs and values usually are held long-term and are ingrained within one's view of self. It is essential that nurses respect a client's beliefs and values, particularly for non-traditional healing practices, as long as they are not harmful to the client. Demonstrating respect and a non-judgmental attitude will help promote a trusting nurse-client relationship. In option 2, arranging respite care for the daughter is premature at this time. This may eventually become necessary. Option 3 is an inappropriate intervention by the nurse. Only the daughter can come to the conclusion that it is her responsibility to care for her mother. Option 4, this is not the priority. This intervention may be done after a discussion with the client, daughter, and husband. A family member requests relief from caring for a relative who has a history of excessive intake of alcohol and a rapidly debilitating malignancy. To which resource should the nurse refer the family member for respite care? 1. Hospice. 2. Meals on Wheels. 3. Ambulatory Care Center. 4. Substance Misuse Treatment Center. The correct answer is 1. Hospice. Rationale: a hospice program is an example of an agency that may provide or arrange for respite care in a healthcare facility or in the home. The caregiving role is physically and emotionally grueling, and family members may need relief from the caregiving role or a break to attend a family function or go on vacation. Meals on Wheels does not provide respite care. It provides nutritious, low-cost meals for homebound people so that they can remain in their own homes. Ambulatory care centers do not provide respite care. Ambulatory care centers provide care for people with conditions that do not require hospitalization. Services may include diagnosis and treatment of disease and illness, as well as simple surgical procedures in which the client returns home the same day. A substance misuse treatment center does not provide respite care. It provides a specialized service in the care and treatment of individuals who misuse alcohol or drugs. A nurse in a clinic is caring for clients in a variety of age groups. Which age group should the nurse anticipate will have the highest potential to demonstrate regression when ill? 1. Infants. 2. Toddlers. 3. Adolescents. 4. Young adults. The correct answer is 2. Toddlers. Rationale: toddlers are less able to understand and interpret what is happening to them when ill. Therefore, they commonly regress to a previous level of development in an attempt to reduce anxiety. Infants already demonstrate behavior on the most basic level. Adolescents generally want to behave in an adult manner and therefore demonstrate a controlled behavioral response to illness. Although some young adults may regress to an earlier level of development as a coping strategy, regression commonly is not used as a defense mechanism when coping with illness. A nurse is assessing a 4-year-old child's growth and development. Which activity should the nurse expect the child to be capable of performing? Select all that apply. 1. Dresses self. 2. Uses toy tools. 3. Hops on one foot. 4. Rides a two-wheel bicycle. 5. Swims using the freestyle stroke. The correct answers are 1. Dresses self. 2. Uses toy tools. And 3. Hops on one foot. Rationale. Preschool-age children have the fine motor skills to open and close zippers and buttons. Preschool-age children have the motor skills necessary to manipulate a toy tool, such as a hammer. Preschool-age children have the gross motor skills and balance to be able to hop and skip on one foot, balance on one foot, and perform a broad jump. Preschool-age children do not have the strength and balance to ride a two-wheel bicycle. A preschooler usually can ride a tricycle. School-age children, not preschool-age children, usually are able to ride a two-wheel bicycle. Preschool-age children do not have the strength and coordination to swim using the freestyle stroke. Some preschool-age children are able to do the doggy paddle. School-age children, not preschool-age children, usually are able to swim using the freestyle stroke. After arriving at a home location that has a history of domestic violence, a home care nurse believes that the environment may be unsafe. Which is the best nursing action? 1. Leave the home immediately. 2. Defuse the situation in the home. 3. Call the police for a personal escort. 4. Complete the visit quickly while remaining alert. The correct answer is 1. Leave the home immediately. Rationale. Nurses must remove themselves immediately from any environment that they believe is unsafe. Attempting to defuse the situation may make the situation worse and place the nurse at additional risk. Calling the police may inflame the situation or take too long for an officer to arrive. Attempting to complete the visit may place the nurse at additional risk. A nurse identifies that an adult has an unresolved developmental conflict associated with adolescence. Which behavior supports this conclusion? Select all that apply. 1. Being overly concerned about following daily routines. 2. Requiring excessive attention from others. 3. Relying on oneself rather than others. 4. Failing to express a sense of self. 5. Lacking goals in life. The correct answers are 4. Failing to express a sense of self, and 5. Lacking goals in life. Rationale. A main developmental task of adolescence is being capable of determining who you are. An inability to express a sense of self later in life reflects an unresolved conflict of identity versus role confusion. A main developmental task of adolescence is forming a sense of personal identity as a foundation for the tasks of young adulthood, making decisions regarding career choices, and selecting a mate. An adult who has difficulty setting goals in life indicates an unresolved conflict of identity versus role confusion. 1. This relates to Freud's anal stage of development. According to Freud, if a parent is strict, overbearing, and oppressive during toilet training, the child may develop traits of an anal retentive personality. Seeking excessive attention from others is most likely the result of an unresolved task of the 6 to 12-year-old age group, industry versus inferiority. Seeking attention often is an attempt to increase self-esteem. People who have difficulty accepting help from others or who would rather do things themselves generally have not completely resolved the developmental task of infancy, trust versus mistrust. A nurse must collect information about a community to identify its needs, which is the most significant assessment by the nurse. 1. The demographics of the community. 2. What the community thinks is important. 3. How many support services are available. 4. Environmental data as they relate to public safety. The correct answer is 2. What the community thinks is important. Rationale. The members in the community are the primary source of data about the community and its needs. Just as the client is the center of the healthcare team when caring for an individual, the collective membership of a community is the center of the healthcare team when caring for the healthcare needs of a community. A nurse identifies that a client in middle adulthood is experiencing a developmental crisis. Which of the person's behaviors supports this conclusion? Select all that apply. 1. Unable to mentor children in the next generation. 2. Difficulty in developing peer relationships. 3. Inability to achieve feelings of success. 4. Incapable of delaying satisfaction. 5. Failure to face eventual death. The correct answers are 1. Unable to mentor children in the next generation, and 3. Inability to achieve feelings of success. Rationale. A task associated with middle adulthood is sharing of self and performing activities that promote the growth of others, particularly those in the next generation. A major task of middle adulthood is successfully fulfilling lifelong goals that involve family, career, and society. If these goals are not achieved, a crisis often is precipitated. Developing peer relationships is one of the developmental tasks of the 6 to 12-year-old child and adolescent, not the middle-aged adult. Delaying satisfaction is one of the developmental tasks of the 18-month to 3-year-old child, not the middle-aged adult. Facing death is one of the developmental tasks of the 65-year-old and older adult, not the middle-aged adult. A woman is concerned about her children accidentally ingesting her husband's prescribed medications. Where should the home care nurse teach the mother to keep medications? 1. On a high shelf. 2. In a locked cabinet. 3. In a medicine cabinet in the bathroom. 4. On a shelf in the back of the refrigerator. The correct answer is 2. In a locked cabinet. Rationale. A locked area is the safest place to store prescribed as well as over-the-counter medications to prevent accidental ingestion by children. A high shelf, medicine cabinet in the bathroom, a shelf in the back of the refrigerator are not safe places to keep medications. Children have natural curiosity, problem-solving abilities, and the agility to climb to a top shelf. A nurse identifies which word is being related to a principle of growth and development. Select all that apply. 1. Predictable. 2. Sequential. 3. Integrated. 4. Complex. 5. Static. The correct answers are 1. Predictable. 2. Sequential. 3. Integrated. And 4. Complex. Rationale. Growth and development comprise an orderly process that follows a predictable path. There are 3 predictable patterns. Cephalocaudal, proceeding from head to toe, proximo-distal, progressing from gross motor to fine motor movements, and symmetrical, both sides developing equally. Growth is marked by measurable changes in the physical aspects of the life cycle, and development is marked by behavioral changes that occur because of achievement of developmental tasks and their resulting functional abilities and skills. Growth and development follow a sequential timetable whereby multiple dynamic changes occur in a systematic and orderly manner. Individuals grow and develop in the physiological, cognitive, psychosocial, moral, and spiritual realms in an integrated way, with each one influencing the others. Growth and development comprise a complex process that involves multiple influencing variables, such as genetics, experience, health, culture, and environment. The word static means stationary, stagnant, or fixed. Growth and development are dynamic and progressive. A client's contract for home care services is about to end, but the client still requires care. On which factor will the continuation of services initially depend? 1. Nursing documentation of the need for care. 2. Retrospective audits of quality management. 3. Client satisfaction with the care being provided. 4. Presence of a primary healthcare provider's prescription. The correct answer is 1. Nursing documentation of the need for care. Rationale. Case management by the nurse in the home care setting includes determining whether a client is ready for discharge or requires a continuation of services. The nurse must document objectively the status of the client to convince those making the decision that the client requires a continuation of services. Nursing documentation is the initial intervention that supports the decision to continue home care services. Quality management activities are unrelated to whether a client is to receive a continuation of services or is to be discharged from a home health care program. Ongoing quality management programs are designed to monitor the quality of care being delivered and identify problem areas so that efforts can be employed to improve care. Dissatisfaction with the services of a home health agency may influence whether or not the client and/or family wants a continuation of services. However, satisfaction or dissatisfaction should not influence whether the client still needs the services of the home health care agency. Ultimately, a primary health care provider's prescription is necessary to initiate home care services, continue health care services, and identify interventions to be performed by nurses that are within the scope of nursing practice. However, the health care provider's prescriptions take into consideration nursing documentation of the need for care and input from agency managers and the client's insurer. A nurse is facilitating a mother's class, and the women begin discussing experiences that reflect the intellectual development of their children. Each woman describes a situation that reflects one of the stages of Jean Piaget's theory about logical thinking. Place the situations described in order, beginning with the sensor-motor stage and ending with formal operations. 1. My son touched the radiator and got burned. He'll never do that again. 2. My son is learning math and is getting 100s on his tests. He is so smart. 3. My daughter is on the debating team in school. We go to inter-school meets. 4. My daughter asked an obese lady if she had a baby in her stomach. I was so embarrassed. The correct order is 1. My son touched the radiator and got burned. He'll never do that again. 4. My daughter asked an obese lady if she had a baby in her stomach. I was so embarrassed, too. My son is learning math and is getting 100s on his tests. He is so smart. 3. My daughter is on a debating team in school. We go to inter-school meets. Rationale. The sensory motor stage, birth to 2 years, is governed by sensations in which simple learning takes place. It progresses from reflex activity through repetitive behaviors to imitative behavior. These children are curious, experiment, and learn primarily through trial and error. The preoperational stage, 2 to 7 years, involves thinking that is concrete and tangible. These children cannot reason beyond the observable. Also, their thinking is transductive. That is, knowledge of one characteristic is transferred to another. The concrete operational stage, 7 to 11 years, reflects an increasing ability to use symbols and understand relationships between things and ideas. Judgments are made based on what they reason rather than just what they see. Also, they develop the concept of conservation. That is, physical remain the same even though outward appearances may change. The formal operational stage, 11 to 15 years, involves thinking that is abstract, theoretical, philosophical, and hypothetical. Thinking is characterized by flexibility, adaptability, and drawing logical conclusions. A nurse identifies the healthcare needs of the members of a community, which is the nurse's most efficient initial approach to meet these needs. 1. Involve community leaders to work within the political arena to obtain funding for programs. 2. Write research grants to explore the community's health needs in more detail. 3. Design educational programs that address the identified community needs. 4. Make clients aware of the resources in the community. The correct answer is 4. Make clients aware of the resources in the community. Rationale. Option 4 is the most efficient initial approach to meeting the identified needs of the members of the community. The use of currently available resources is more efficient than the other options presented. Option 1 is not the most efficient approach. This may be necessary if present resources are not available to meet the needs of the community. In Option 2, the health needs of the members of the community are identified already. Further study at this time does not appear to be appropriate. In Option 3, designing educational approaches is not the most efficient approach. This may eventually be done after an action in another option is implemented first. Which common physiological change associated with aging should the nurse assess for an older adult? Select all that apply. 1. Increase in sebaceous gland activity. 2. Deterioration of joint cartilage. 3. Loss of social support system. 4. Decreased hearing acuity. 5. Increased need for sleep. The correct answers are 2. Deterioration of joint cartilage, and 4. Decreased hearing acuity. Rationale. Older adults generally experience a deterioration of the hyaline cartilage surface of joints, which tears, allowing bones to be in direct contact with each other. Often, this results in the formation of spurs or projecting points that limit joint motion. Hearing acuity decreases, particularly in relation to high-pitched sounds, because of atrophy in the organ of chordae and cochlear neurons, loss of sensory hair cells, and degeneration of the stria vascularis. Although sebaceous glands increase in size with age, the amount of sebum produced decreases, hastening the evaporation of water from the stratum corneum and resulting in cracked, dry skin. Loss of a social support system is a psychosocial, not physiological, change commonly experienced by older adults. Older adults have the same need for sleep as younger individuals. However, it is more difficult for older adults to obtain the quality and quantity of sleep desired. Chemical, structural, and functional changes in the nervous system disrupt circadian rhythms and sleep. A home care nurse is performing an initial client and home assessment, which is the most essential assessment that must be made by the nurse. 1. Can the home environment support the safety of the client? 2. Is the family willing to participate in the client's recovery? 3. Does the client have the potential for self-care? 4. Can the client participate in the plan of care? The correct answer is 1. Can the home environment support the safety of the client? Rationale. The first and most important assessment made by the home care nurse focuses on determining whether the client's home environment is safe. Safety and security are one of the more basic needs identified by Maslow's hierarchy of needs. Although it is often helpful when family members participate in a home care client's recovery, it is not necessary. A client's potential for self-care is not a criterion for receiving home care services. Clients who have little or no potential for self-care receive home care services. Clients who are unable to participate in the plan of care because they are mentally, emotionally, or physically disabled are still eligible for home care. A nurse determines that, according to Erickson, establishing relationships based on commitment mainly occurs in which stage of psychosocial development? 1. Middle-age adulthood. 2. Young adulthood. 3. Adolescence. 4. Infancy. The correct answer is 2. Young adulthood. Rationale: young adults, 18 to 25 years. Intimacy versus isolation. Strive to establish mature relationships, commit to suitable partners, and develop social and work roles acceptable to society. Unsuccessful resolution results in self-absorption, egocentricity, and emotional isolation. Middle-aged adults, 25 to 45 years. Generativity versus stagnation. Strive to fulfill life goals associated with family, career, and society, as well as to give to and care for others. Adolescents, 12 to 20 years. Identity versus role confusion. Strive to make the transition from childhood to adulthood with a sense of personal self. Infants, newborn to 18 months. Trust versus mistrust. Strive to have their needs met through interacting with others. When their needs are consistently met, they develop a sense of trust in their caregivers. During the process of performing a community assessment, the nurse invites members of the community to come to a meeting and share opinions and concerns about a particular issue, which is this method of data collection. 1. An opinion survey. 2. A community forum. 3. A demographic assessment. 4. An observation of participants. The correct answer is 2. A community forum. Rationale: a forum is defined as an opportunity for open discussion, inviting people from the community to share opinions and concerns about a particular issue for the purpose of collecting data is called a community forum. An opinion survey is designed to collect each individual person's perspective about the problem being studied. Results are tallied to identify the major concerns. Opinion surveys generally are questionnaires. A demographic assessment is a quantitative study of the characteristics of a population. A demographic assessment might include information such as distribution of the population by gender, size, growth, density, and ethnicity. Direct observation is a method of data collection that may be used to determine whether individuals follow a specific procedure or behave in an expected manner. A school nurse is teaching a class of adolescents about nutrition. Which age group should the nurse identify as having the highest energy expenditure and nutrient requirements? 1. End of the life cycle. 2. Middle adult years. 3. Early adult years. 4. First year of life. The correct answer is 4. First year of life. Rationale: during the first year of life, nutritional needs per unit of body weight are the greatest in comparison to any other time during the lifespan. Birth weight generally doubles in 4 to 6 months and triples by the end of the first year. Older adults experience decreases in basal metabolic rate, lean body mass, and physical activity that contribute to a decrease in caloric needs. Energy expenditure decreases, and nutritional needs stabilize during the middle adult years. People in other age groups have greater needs for nutrients to meet physiological demands than do those in the middle adult years. Although young adults tend to be active and require nutrients adequate to meet high energy expenditure, physical growth slows and the basal metabolic rate begins to stabilize, so they require fewer calories than do other age groups. A nurse must conduct a community assessment. Which information should the nurse collect first? 1. General health of community members. 2. Characteristics of community members. 3. Physical environment of the community. 4. Social services available in the community. The correct answer is 2. Characteristics of community members. Rationale: clients are the center of all healthcare, including community healthcare. Acquiring core information about the people in the community is the first stage in assessing a community. Core characteristics about the members of a community include information such as vital statistics, values and beliefs, demographics, religious groups, and so on. A hospice nurse is providing emotional support for 8 young children of a dying mother. At which age do children first recognize that death is irreversible, universal, and natural? 1. 9 years of age. 2. 6 years of age. 3. 15 years of age. 4. 12 years of age. The correct answer is 1. 9 years of age. Rationale: a 9-year-old child has a more realistic understanding of death than a younger child and recognizes that death is universal, irreversible, and natural. A 9-year-old child has a beginning knowledge of his or her own mortality and may fear death. A 6-year-old child is developing an understanding of the differences among the concepts of past, present, and future. A 6-year-old child believes that death is temporary, can be caused by bad thoughts, and may be a punishment, and that magic can make the dead person alive. Recognizing that death is irreversible, universal, and natural occurs at an earlier age than 15 years. Recognizing that death is irreversible, universal, and natural occurs at an earlier age than 12 years. A home care nurse is providing care for a family supporting a client with a chronic illness, which is the most important factor the nurse should teach caregivers who care for a family member who has a stable but chronic illness and is living in the home. 1. Have extra equipment and supplies for emergencies. 2. Plan a daily and monthly schedule of activities. 3. Keep a daily journal of the client status. 4. Tend to themselves as well as the client. The correct answer is 4. Tend to themselves as well as the client. Rationale. Caregiver role strain experienced by a family member is a serious concern of home care nurses. Caregivers often fail to address their own health needs because of the extraordinary burden of the caregiver role, which can jeopardize their own health and well-being. Caregivers should be encouraged to delegate responsibilities to other family members, get adequate sleep, rest, and nutritional intake, seek assistance from agencies that provide respite services, take time for leisure activities and a vacation, and join a caregiver support group. Option 1 is a good idea. It is not the most important factor a home care nurse can convey to a person caring for a family member in the home. Option 2 might contribute to efficiency, as well as gaining a feeling of control over the activities that must be accomplished. It is not the most important factor a home care nurse can convey to a person caring for a family member in the home. A nurse is caring for several children on a pediatric unit. Children in which age group should the nurse expect will be most unstable and challenging with regard to the development of a personal identity? 1. Toddlerhood. 2. Adolescence. 3. Childhood. 4. Infancy. The correct answer is 2. Adolescence. Rationale. Adolescence, 12 to 20 years, identity versus role confusion, have more multiple and complex milestones than individuals in any other stage of development. These milestones are physiological, psychological, and social. The multiplicity of these stressors can have a major impact on the development of the adolescent's personal identity and sense of self. Although toddlers, 18 months to 3 years, early childhood, autonomy versus shame and doubt, experience a number of developmental milestones, toddlerhood is not as unstable or complex as another stage of development. Toddlers explore and test the environment, develop independence, and have a beginning ability to control the self. Although children in early childhood or toddlerhood, 18 months to 3 years, autonomy versus shame and doubt, and late childhood, 3 to 6 years, initiative versus guilt, experience a number of developmental milestones, their development is not as unstable or complex as that of another age group. The main tasks of childhood are achievement of self-control, initiation of one's own activities, and development of purpose and competence. Although infants, birth to 18 months, trust versus mistrust, experience a number of developmental milestones, their development is not as unstable or complex as that of another age group. The main tasks of infancy are to adjust to living in and responding to the environment and to develop trust. A community health nurse is to care for a client who was just discharged from an acute care facility after receiving initial medical care for tuberculosis. The family recently immigrated to the country from another country. Place the following interventions in the order in which they should be performed by the nurse. 1. Explore community resources that can help support the client and family. 2. Perform an assessment of the client and home environment. 3. Meet with the client and family in their home. 4. Review the client's medical record. 5. Identify client and family needs. The correct order is 4. Review the client's medical record. 3. Meet with the client and family in their home. 2. Perform an assessment of the client and home environment. 5. Identify client and family needs. And 1. Explore community resources that can help support the client and family. Rationale. Before meeting with the client and family, the nurse should obtain as much information about the client as possible. An assessment of the home environment can be performed only in the home. The client's family members should be included when feasible because they may provide emotional support and/or be involved with physical care of the client. A health history and physical assessment of the client should be performed by the community health nurse. The information on the client's clinical record may not reflect the client's current status. The home must be assessed to ensure that it is a safe environment for the client and that care can be delivered adequately to meet the client's needs. The nurse, in conjunction with the client, must identify present needs. Once this is accomplished, then goals and objectives can be identified and a plan of care formulated. Once a plan of care is formulated, then the nurse, in conjunction with the client, can identify community resources that may assist them in attaining the goals and objectives of the plan of care. A nurse is planning a teaching session for an older adult about a prescribed medication regimen. which is a major concern about older adults that the nurse should consider. 1. They experience an increase in absorption of drugs from the gastrointestinal tract. 2. They are less motivated to follow a prescribed drug regimen. 3. They are less likely to learn due to a decline in intelligence. 4. They have a decreased risk for adverse reactions to drugs. The correct answer is 2. They are less motivated to follow a prescribed drug regimen. Rationale. The literature documents that older adults are at high risk for non-adherence to a medication regimen because of its complexity. The larger the number of medications and the larger the number of doses per day, the higher the risk of non-adherence. One study indicated that the adherence rate was 87% for daily dosing, 81% for doses twice a day, 77% for doses 3 times a day, and 39% for doses 4 times a day. Other reasons for not fully adhering to a drug regimen include inconvenience, side effects, financial limitations, and/or perceived ineffectiveness of the drugs. Which statement reflects hospice care in the healthcare delivery system? Select all that apply. 1. Clients predicted to have less than half a year to live receive services. 2. It assists families to care for their dying relatives at home. 3. Care is less expensive than in the acute care setting. 4. Support is given to the client and family members. 5. Hospice is a method of care rather than a location. The correct answers are 1. Clients predicted to have less than half a year to live receive services. 2. It assists families to care for their dying relatives at home. 3. Care is less expensive than in the acute care setting. 4. Support is given to the client and family members. And 5. Hospice is a method of care rather than a location. Rationale. To be eligible for hospice services, individuals are predicted to have less than 6 months to live. It is a service to support clients and their families through the process of dying. Most hospice care is delivered in clients' homes supported by a team of healthcare providers and volunteers. However, there are inpatient hospice programs, palliative care units in hospitals, and residential hospice settings. The majority of hospice care is provided in the home. The home is a less expensive setting than other healthcare settings because family members provide most of the care, supported by a team of professionals, non-professionals, and volunteers. Hospice services provide supportive care, physical care, and promotion of the quality of life for the terminally ill client and family members. In addition, hospice care assists family members with bereavement and adjustment after the death of the client. Hospice is not a location, but a concept. It provides supportive, palliative services that focus on managing pain, treatment of symptoms, and helping clients maintain their quality of life so they can live the remainder of their lives to the fullest. Which concept is reflective of Erik Erikson's theory of personality development? 1. Defense mechanisms help people to cope with anxiety. 2. Moral maturity is a central theme in all stages of development. 3. Achievement of developmental goals is affected by the social environment. 4. 2 continual processes, assimilation and accommodation, stimulate intellectual growth. The correct answer is 3. Achievement of developmental goals is affected by the social environment. Rationale. Erik Erikson expanded on Freud's theory of personality development by giving equal emphasis to the influence of a person's social and cultural environment. He stressed that psychosocial development depends on an interactive process between the physical and emotional variables during a person's life at 8 distinct stages. Each stage requires resolution of a developmental conflict that has opposite outcomes, and that requires interaction within the self and with others in the environment. Sigmund Freud, not Erik Erikson, identified that defense mechanisms are used to reduce anxiety by preventing conscious awareness of threatening thoughts or feelings. Lawrence Kohlberg, not Erik Erikson, established a framework for understanding the development of moral maturity, which is the ability to recognize independently what is right and what is wrong. Assimilation and accommodation of new information necessary to stimulate intellectual growth comprise a concept basic to Jean Piaget's theory of cognitive development, not Erikson's theory of personality development. Assimilation involves the process of organizing new information into one's present body of knowledge, and accommodation involves rearranging and restructuring thought processes to deal with the imbalance caused by new information and thereby increase understanding. Identify the nursing intervention that reflects tertiary healthcare delivery. Select all that apply. 1. Providing emotional support to family members after the death of a relative. 2. Teaching a client how to use a wheelchair after a stroke. 3. Implementing a prescribed hemodialysis treatment. 4. Administering an influenza vaccine. 5. Changing a dressing after surgery. The correct answers are 1. Providing emotional support to family members after the death of a relative. 2. Teaching a client how to use a wheelchair after a stroke. And 3. Implementing a prescribed hemodialysis treatment. Rationale. Providing bereavement services is an example of a tertiary healthcare service. Tertiary care is associated with rehabilitation, long-term care, and care of the dying. Healthcare delivery includes primary, secondary, and tertiary care. Teaching a client how to use a wheelchair after a stroke is an example of a tertiary healthcare service. Tertiary services provide care related to rehabilitation. Implementing a prescribed hemodialysis treatment is an example of tertiary healthcare. Tertiary healthcare includes providing palliative care and supporting comfort and quality of life, as well as maximizing abilities in light of chronic or irreversible conditions. Immunizations are an example of primary, not tertiary, healthcare delivery. Primary healthcare is concerned with promoting health, preventing disease, and providing environmental protection and health education. Changing a dressing after surgery is care associated with the secondary, not tertiary, level of healthcare delivery. Secondary healthcare is associated with acute care, complex diagnosis and treatment of disease and illness, and emergency care. A 70-year-old client tells the nurse about experiencing problems with sleep and requests sleeping medication. Which concept associated with drug therapy and quality of sleep is important for the nurse to explain when providing nursing care for this client? 1. Sedatives are not well tolerated by older adults. 2. Anti-anxiety drugs are the least helpful to support sleep. 3. Effectiveness of hypnotics increases with prolonged use. 4. Melatonin is a drug of choice for long-term use in sleep disorders. The correct answer is 1. Sedatives are not well tolerated by older adults. Rationale. Sedatives are not well tolerated by older adults because a decrease in the metabolism and excretion of the drug can result in toxicity. In addition, older adults may experience idiosyncratic effects. Anti-anxiety drugs depress the central nervous system and therefore are helpful in supporting sleep. The effectiveness of hypnotics decreases, not increases, with prolonged use. They should be used only as a short-term intervention because tolerance and rebound insomnia occur in approximately 4 weeks. Although melatonin demonstrates promise as a drug to support sleep, it is not the drug of choice because its safety and efficacy for long-term use are not yet established. Which activity is an example of an intervention associated with secondary healthcare delivery? Select all that apply. 1. Conducting a cardiac risk assessment for middle-aged adults. 2. Teaching a low-fat diet to a person with high cholesterol. 3. Immunization of a child during the first year of life. 4. Providing a class on smoking cessation. 5. Monthly breast self-examinations. The correct answer is 5. Monthly breast self-examinations. Rationale. Monthly breast self-examinations are associated with secondary healthcare services because they are concerned with detection of breast cancer. Option 1 is a primary, not secondary, healthcare delivery. Risk assessments for specific diseases are included in primary healthcare services. Primary healthcare services are concerned with generalized health promotion and specific protection against disease. In option 2, a low-fat diet generally is part of a medical management program for a person who is overweight or who has high cholesterol. This is a tertiary, not secondary healthcare service. Tertiary healthcare services are associated with attempts to reduce the extent and severity of a health problem in an effort to limit disability, as well as restore and maintain function. In option 3, administering an immunization is a primary, not secondary healthcare service. Primary healthcare services include protecting people from disease. Providing a class on smoking cessation is associated with primary, not secondary healthcare. Primary healthcare is associated with health promotion and illness prevention. When the nurse assesses an adult client, which client behavior may indicate an unresolved developmental task of infancy? 1. Avoiding assistance from others. 2. Rationalizing unacceptable behaviors. 3. Being overly concerned about cleanliness. 4. Apologizing constantly for small mistakes. The correct answer is 1. Avoiding assistance from others. Rationale. People who avoid help from others and who would rather do things themselves generally have not completely resolved the developmental task of trust versus mistrust during infancy. Rationalizing unacceptable behaviors is a defense mechanism, not an indication of an unresolved developmental task of infancy. Rationalization is used to justify in some socially acceptable way ideas, feelings, or behavior through explanations that appear to be logical. Option 3 relates more to the anal stage of Freud's psychosexual theory of development. Freud believed that when toilet training is approached in a rigid and demanding manner, a child develops into an adult who is overly concerned with orderliness and cleanliness. Option 4 indicate an unresolved conflict of autonomy versus shame and doubt associated with the 18-month to 3-year-old age group. One of the developmental tasks of this age group is learning right from wrong. When parents are overly critical and controlling, a child may be overly self-judgmental and become an adult who feels the need to apologize for small mistakes constantly.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.